Check, check. check, check.
Go.
Check, check. Two, two, two. Check, check.
I'm gonna put your water over there.
That's fancy.
All right, good morning. Can everyone hear me?
Morning. Is the mic working?
It is, yeah? Okay. I am honored to have this opportunity to welcome everyone to American University on this beautiful spring day for the 2024 CARE Conference on Economic Policies for Gender and Racial Equity, co-sponsored by the Institute for Women's Policy Research and American University. My name is Kara Reynolds, and I'm the chair of the Department of Economics here at American University. The department has been proud to host the program on gender analysis and economics, a research and graduate training program which emphasizes the importance of both theoretical and empirical research in gendered-focused economics. Over the years, research projects associated with the PJE have investigated the role of gender in labor markets, finance, development, and social reproduction. As part of this work, the department has valued its close partnership with IWPR since 2018. This partnership reflects both institutions' commitment to research on the role of women in all aspects of the economy as a way to shape the policies that will ensure equity for women and other underrepresented groups and promote the economic well-being of all families. We hope to continue these efforts through the PJE, our partnership with IWPR, and other department initiatives, including our newly formed Institute for Macroeconomic and Policy Analysis. Today's conference is special in that it brings together both academic researchers and those on the front line in policy and advocacy. Over the course of the day, we will have the opportunity to hear cutting-edge research on a variety of topics, including the challenges associated with an aging population, the importance of care work in an economy, and the intersection with immigration policy. We'll hear from those actively engaged in proposing and implementing policy. The development of the policy needed to address both gender and racial inequality starts with discussions like we are having today, and I look forward to all our discussions. Thank you.
Good morning. Good morning. Yes. Thank you, Cara. Oh, thank you. Thank you, Ariane. Can everyone hear me back there? Thank you. Okay. Well, my name is Robin Watson Ellerby, and I am the Chief Strategy Officer at the Institute for Women's Policy Research. And like, excuse me, and like Cara said, IWPR has had a long-standing relationship with the American University. And we appreciate the partnership and contributions, the university's partnership and contributions to our mission of achieving economic equity for women. Regarding appreciation, I want to also thank the AU staff that have been involved in organizing this conference. We really appreciate that. As equally important, I'd like to thank the IWPR staff that I've personally seen put in numerous hours and immense amount of effort in organizing a conference like this. In addition, before we get into this important topic of care, I am tasked to talk about another important topic that is always important when anyone is convening or at a conference or a meeting, and that is bathroom location. The bathrooms are located, if you saw at the registration when you came in, right around the corner, so behind me. That's where you will find them. And also when you are not in the bathroom or in our sessions, we also would like for you to participate in brief interviews that we are doing on behalf of IWPR. We really would like to hear about your experience at the conference, the information that's being shared, or if you just want to speak about some of the wonderful and rigorous research in IWPR products, we would love to hear that from you. As a matter of fact, if you are willing, there was an opportunity at the registration desk to put like a yellow sticker on your badge. And so if you would like, they can put that, and then our staff will know that you are willing to participate in this brief interview. And I also want to point out who you would be, who would be the communication staff that would be coming up to you. And I think Susan, I see, so she can wave. She's got our awesome glasses on. So if you see her coming up to you, she just wants to speak to you about some of those things. We also ask that you connect to the conversation online, and that's with the hashtag IWPR research, and that is 1R. So it's IWPR ESEARCH and the hashtag care conference. Okay, care conference. So now let's get on to the important topic of care. Let's discuss why we're here. Everyone in this room, at the beginning of their life, by the very nature of being born, has been cared for. And within our lifetime, the majority of us will care for another person, whether it's a child, a parent, or other loved one, or by the very nature of your occupation. Care is the cornerstone of economic activity. And it's not a Democratic or Republican issue, it's a human issue. As a matter of fact, this week we released findings from a new national poll that we did in concert with Morning Consult, showing that majority of adults, and this means over 80% of adults, across party lines consider it important for Congress to take action on ensuring paid time off to care for themselves or loved ones. Increased investments in affordable quality care, and that includes child care, elder care, or care for people with disabilities, and to pass legislation to strengthen equal pay protections and increase pay transparency. All issues that disproportionately impact women's ability to fully participate in the workforce. That is why the purpose of this meeting is to bring together, like Cara said, policy researchers, advocates, and policymakers to delve into new research and policy initiatives on care, with a specific focus on gender and racial equity throughout the life cycle. As such, we are beginning this conference with our open and plenary, exploring the care nexus, intersections of care, gender, and racial inequality. And as part of that, I have the privilege of introducing the moderator of the open and plenary. Dr. Jamila Taylor is the new CEO and president of IWPR, which also means my new boss. She is a national health equity leader, seasoned health policy researcher, and social justice advocate. Her work focuses on issues related to maternal health and reproductive justice, structural barriers to health care access, racial and gender disparities in health outcomes, and the intersections between healthcare and economic justice. For over 20 years, through her research and publications, leadership positions, testimonies before Congress, Jamila has championed the health and rights of women both domestically and globally, promoting policies that ensure access to vital health care. So it seems only fitting that she would bring her talents to IWPR and lead us in our work of creating evidence-based research that influences policy to improve the lives of women and their families. So without further ado, my boss, Dr. Taylor.
Thank you. Good morning, everyone. So I am so excited to be here this morning. Thank you, Robin, for the introduction. Before we get started with the panel, I do want to acknowledge Heidi Hartman for being a trailblazer and founding IWPR. Heidi, want to give a wave? Are you in the room? Okay. Maybe she's not in the room yet. I know she's going to be joining us today, or the plan is for her to join us today. So definitely, if you see her, say hello. So I am headed into my third month at IWPR, and they're already putting me to work. And it's exciting that I get to spend, this day with you all at the CARE conference, my first CARE conference. So before we get into the details of this phenomenal panel, want to make sure that you all stay engaged, both in the room and online, by live tweeting, engaging in social media, using the hashtag CareConference and the hashtag IWPR Research with 1R when posting. So IWPR's work on caregiving was part of what drew me to this position. I'm proud that we continue to place a high priority on this crucial issue with this conference and the recent polling that Robin mentioned. This conference follows from our 2022 U.S. Care Infrastructure Conference, which many of you may be aware of. We organized that conference when it still looked as if investments in roads and bridges would be matched with investments in the care infrastructure. We were also coming out of the COVID-19 pandemic, which had made clear the link between gender and racial inequality and paid and unpaid care work clearer than ever. This conference, CARE Conference 2024, just 2 years later, continues that focus on care and gender and racial equality and hopes to help set a path for the policy changes we desperately need at the federal level. The purpose of this opening plenary, exploring the care nexus, intersections of care, gender, and racial inequality, is to set the stage for the day and tee up the issues we need to address. Then, after a meaningful discussion, our final plenary will focus more directly on solutions. So with that, I'm ecstatic to announce the panelists for today. So I'm going to read off condensed versions of their bios, but really encourage you all to read the full versions online. So first we have Krishana Lloyd. Krishana is a research scholar at Child Trends and a nationally recognized expert on the study and implementation of interventions to support early childhood professionals, including home and community-based care settings. She co-directs the National Early Care and Education Workforce Center, a $30 million 5-year initiative started in 2023 and focuses on Black children and families. Next, we have Mia Ives Ruble from the Disability Justice Initiative at the Center for American Progress. Mia is best known for founding the Women's March Disability Caucus, where she helped also organize the Women's March on Washington in 2017, the first one. And she has been recognized by Glamour Magazine as one of 2017's Women of the Year. And she's also been recognized by She the People as one of 20 women of color in politics to watch in 2020. And in 2019, received the Distinguished Alumni Award from the University of North Carolina School of Social Work. Next, just glad that wasn't the water spilling. Thank you, Krishana. And next we have IWPR's newest team member, Kate Bond. Yes. Let's clap for that. We can never have too many economists on our team here at IWPR. So Kate is the Chief Economist and Senior Vice President of Research. Before Kate joined us, she served as the Director of Research of WorkWise at the Urban Institute, and she previously served as Chief Economist and Director of Labor Market Policy at the Washington Center for Equitable Growth. Last but not least, we have Tiffany Boyman, who is the Deputy Director of the U.S. Women's Bureau. Tiffany has been there since 2017. She joined the Women's Bureau from IWPR, another alum, where she worked particularly on IWPR's Status of Women program. And she has also worked for Women Work, the National Governors Association, and the U.S. Government Accountability Office. So let's give all of our panelists a round of applause. So to get things started, we're going to have Krishana join us at the podium where she will focus her talk on understanding the ways in which early care and education is devalued in the United States using history and policy as a framework.
Need to get to my notes. And just go forward for the slide. Okay. So as you heard, my name is Krishana Lloyd. I'm a researcher at an organization called Child Trends, which is a national think tank. We conduct research, we do evaluation, provide strategic planning, technical assistance in key areas that are important to children's well-being. So care is certainly one of those areas. I sit in the early childhood department, and I do work in that area and also, as you heard, work on families and more specifically Black families. So I'm going to be talking to you about a particular piece of work, actually two bodies of work that really focus on understanding care and the history of care. And I just want you to look a bit at this visual and just to keep that in mind as we go forward. Okay, so I'm going to be drawing on two bodies of work. One is the Mary Popper Papers, and the cover that you saw in that title slide is from the Mary Popper Papers. They're a set of two papers. And the other body of work that I'll be drawing on is a recently released review, and it's a 100-year review of research on Black families. So I'll use both of those pieces of work to kind of frame some of the conversation. They're really steeped in history. Obviously, the Mary Popper Papers are a set of two papers, one really focusing on history and the other on policy and solutions. So as we move into, kind of the ending plenary, we can talk a little bit about solutions. Both bodies of work combined were a really huge undertaking with about 1,000 resources between them, including peer-reviewed articles, books, newspapers, media, gray literature, right? So drawing on a lot to get you to where we are today and to talk about some of the points that I'm going to make. We also had multiple authors, a ton of reviewers. So all this to say that it was a very rigorous process to get these papers done. And so guarantee what you're hearing is really based and steeped in research and evidence, okay? There are a couple funders for the work. There was the Early Educator Investment Corporation, which is a collaborative of funders, and also Doris Duke and Mackenzie Scott. So that's who funded the work. I think that's important to know. Okay, I'm going to skip this and come back to that. So let's just talk about this timeline a little bit. And this timeline is actually from the Mary Popper Papers. So it's relevant in particular ways and not so particular ways. And the font here is small, and you actually don't need to worry about that. So don't, spend a lot of time zooming in. What I really want to do is to use the timeline from the Mary Popper Papers to help shed light on and to help understand kind of domestic work and care work more generally and the history of that in the country. So what we have here
is a broad timeline. So you see at the bottom, just to orient you a little bit, is a green timeline. And those are just kind of particular eras in our country's history. Above that is a line that's specific, the purple line, to Native American populations. And above that is a line that's particular to Black or African American populations. Okay. And the little lines that you see and the words above are policies. And these are all kind of spelled out in the Mary Popper papers. And again, you don't really need to worry about the policies. The point of really showing you this timeline is the bigger picture here. And the bigger picture here is that we've got about, if you take, and I don't know how to use, I know you told me how to use the laser, but you look here, right? And we look at the timeline. We've got these particular time frames in our history. We've got kidnapping that was happening of Black people from Africa and being brought to United States in this institution that we call chattel slavery, and I'll talk about that a little bit. And we've got, invasion of land here and the genocide of Native American populations, right? And you go on throughout the timeline, you can see some of the atrocities that have happened in the history of our country. What I really love about this timeline, and I have to say thank you to Hannah Barnett and Sarah Shaw, who are two of the co-authors on the papers, for helping me to develop this, because I had it in my head and I really couldn't do it myself, is that it's proportional. And what that means essentially is that you can see for about 75% of the time that this country has been in existence, there have been some really horrible things happening to people of color, okay? And that's a really, really important point and a takeaway from this timeline. Never mind the policies. And the policies are there. Some have been helpful to people of color, some have not. But they are there, right? And we can kind of go into that later. But in a nutshell, what this timeline shows us is that there would be essentially no wealth in the country, no privilege for white Americans, no power were it not for these occurrences and these atrocities that have happened. And I want to be very clear about this, that this is history, right? This is not some wild interpretation. This is actually what happened, okay? So there are a couple things that happened, and I have 5 minutes, so I'm just gonna, time went fast, right? I'm just gonna talk a little bit about this particular slide, and then perhaps we'll have some time to talk later. The first thing that I want you to know here about this slide is you can see the visuals, and the visuals are through the Mary Popper papers, and I think they're really telling and really striking. And you see this bill of sale for slaves, right? People who were enslaved is what I like to say. And if you take a hard look at that, right, and you pay attention to the language used, we've got bucks, we've got wenches, we've got pickaninnies who are young children, right? And this is an advertisement in today's day, like a Facebook marketplace maybe, right? Here are the goods that I have to sell. And with that selling, you have children who were left behind, who were taken away from their mothers and fathers, who were taken care of by other mothers. So this is really kind of our first formal child care system, right? Where you had family, friend, and neighbor care, people banding together, kinship care, which was really about survival. It was about love, it was about protection, and was carried out in defiance almost of a system that was used to break people down, Black people in particular, and strip away their bodies, their lives, and their bonds. Okay, and this is important to understand and know when we talk about history. The other thing, predating kind of this enslavement of Black people in the country was that white women were bought over, right? We had white settlers who were here, men, primarily men. And in order for them to stay and kind of colonize the country, there was a decision made that we needed some women to come too, right? To help them to stay, and we needed to reproduce. And so women were bought over to bear children and to tend to domestic duties and responsibilities. Reading and writing was kind of secondary, maybe that could happen, and really was based around the Bible, right? And kind of knowing where a woman's place was. So you have these two kind of big things that were happening at the beginning of the country, women being bought here to bear children and to tend to homes, and this enslavement of Black people in the country, and care beginning to show itself in many different ways. Within Black communities and within white communities. And so that's kind of just the fabric of where we are in the country. And if we go back to that timeline again, it wasn't that long ago. And that's what I want people to really understand, is that we have about 25% of our period right now in this country where these things have not been happening, but we still got some remnants of them, okay? And I'm gonna skip because I have 2 minutes. And I want to talk just about this picture because I think this is the other thing that's really important to ground the conversation is you look at that top photo there, right? And we would talk about women, and we talked a little bit about Black women and white women and enslavement. And this is a 15-year-old who was trying to go to school, right? Everybody has probably seen this picture, and these are other 15-year-olds, high school students, and other women that are grown screaming at her and yelling at her, right? Because they don't want her to integrate the school. So when we talk about care and we talk about access and we talk about education, because this is all really a part of this hierarchy that I want us to think about too as we move into the discussion. In early care and education, we have family, friend, and neighbor care. We have center-based care. We have care that's provided in schools. There are many different venues. And if you look at the disparities around who's providing what care, you see disproportionately that women of color are at the lower end of the spectrum and hierarchy in terms of positions, leadership, and also in terms of finances. There's a really nice report that was just written and put out by the Center for the Study of Child Care Employment out of Berkeley that really looks at this and illustrates this point using some data from California specifically very clearly. And so what I want you to take away just from this grounding in this history and this foundation is that we've got some sexism happening, right? We have some very particular roles for women and the way women were conceptualized in this country, grounded in this whole ideology around what Black people, enslaved people, were here to do and for whom. And we also have this overlay, this intersection around white women, Black women, and other women, right, who we haven't even gotten to, Asian women and Hispanic women, who are also part of this care economy and this equation that are not quite equal with a very clear hierarchy. So I'm just gonna leave you with that, and then we can come back to it later. Forward to the next slide.
Thank you so much, Krishana. I'm going to give you a moment to take your seat. So many things running through my mind after watching that presentation. You know, one of the things that I want to take a moment and reflect on is the fact that, you know, based on that timeline and the history you showed, you know, it's no mistake that care work is still undervalued in this country. That didn't just happen with COVID-19, right? It's no mistake that, you know, women of color are overrepresented in, you know, these care professions. We have a clear history that shows us that. But we know that COVID-19 did start to shed a light for the public, I think, on, you know, some of these issues around undervaluation of the care workforce and what the impact has been. Can you talk a little bit more about that connection, women of color, and then I think also to where you think we need to go next in terms of the solutions?
Yeah, I mean, so I agree that, am I on? No, it was on. That COVID's definitely shown a light on the need for care. I think we also saw, if we think about, and there's many different facets of care, right? We have kind of healthcare, which you're familiar with. We have early care and education, many different facets of care. And I was just kind of thinking on my way down the road that I've worked in lots of those venues. And I also have a disabled child, so we'll be doing care for the rest of my life. And I think about my own personal experience during COVID, where I was with my child, my son who is disabled, who is physically disabled and developmentally disabled, and big at this point, right? He's 16, so he's bigger than me, and having to change diapers, wash and bathe and feed him, and do all the things 24/7, right? And work my regular job, right? And so I felt it intensely. I was very relieved when school reopened, but it made me also think about my life long term. Because school is not always going to be an option for him, right? And so we think about this care economy, and we think about what we need, and we think about, you know, kind of the resources and some of the supports that were put in place during COVID that are now starting to be rolled back a bit and rethought of. There was a lot of innovation that happened that I'm worried that we may be losing. That to me is really the next step, and what we need to be thinking about is how do we look at the innovations that happened during the pandemic, not just monies, but kind of allocation of monies and where they were going, and who was supported and who was not supported, and to use those lessons and those learnings to move forward in a way that gets us to a place where care can be valued and sustained. To me, those are kind of the next steps. I have lots of thoughts about that, but I know we have to get to the other panel members.
Great. Thank you so much. So next we're going to go to Mia. She does not have a PowerPoint, and she is going to focus on, you know, breaking down what the equity consequences are for disabled people when it comes to underinvesting in care. Mia?
Thank you so much. Good morning, everybody. I hope you didn't drown yesterday. I know it was very rainy all week, actually, right? I'm so glad to be here. I'm the director of the Disability Justice Initiative at the Center for American Progress. I've had a disability all my life and have been sort of in the nexus of care in a multitude of different ways. And what I wanted to actually start you out with is somewhat much like Krishana just did, was talk a little bit about the history and how we actually got to where we are right now. A lot of folks have heard of the term ableism. Raise your hand if you've heard of ableism, right? And the thing is that what I like to talk to people about is that ableism not only affects disabled people, it affects non-disabled people as well. Our expectations on how we produce in this economy and in this country and in this world is dependent on ableism, dependent on the belief that we have to produce or we are not worthy, right? Which actually stems a bit from the chattel slavery that we've seen, also human trafficking, all of those ills that we, chagrin right now, at least most of us. But, I think that one of the things that I tried to talk about is how that is all related to how disabled people have been treated throughout history. Now, you think of the first terms to describe disabled people, right? We called them invalids, right? Invalid people is basically what it meant. We also called them handicapped, which actually came from the belief that disabled people were just out there to mooch. And so they had a cap in their hand begging in society for care. So you think about that, and you think about how disabled people were hidden in society for the beginning of time, right? We either died or we were hidden in communities. And that's still the case in many places around the world today. And so one of the things that I like to talk about is not only did it take until, the quarter of the end quarter of American history to get to the end of slavery and the end of the Black Codes, but it also took until 1990 for disabled people to have a basic civil right to exist and to believe that they deserved to live in the communities that they lived in. So take that into account. When you combine the issues around racism, sexism, and ableism, you create this nexus that really is asking for people to die, basically, which is where we have seen how we have addressed things like COVID-19, right? Because we have decided who we believe is actually worth saving, is actually worth living. So one of the things that I try and talk about is when we were seeing all of the hospitals getting booked up with tons and tons of people, we started seeing these reports coming out stating that hospitals were going to start um, uh, making sure that care only went to people that they believed had a shot in life. And so that meant if you had a developmental disability, right? You had a intellectual disability. You were not deemed worthy to get respiratory care in hospitals if you got COVID-19. And so throughout time, we have spent the better part of American history devaluing disability. One of the things I want to point out is that we look at things like mental health care, which is something that we talk about all the time now, right? Because a lot of people have been affected by the pressures around COVID-19. We're trying to get out of that mental state. People are still dealing with a lot of mental health issues. But it wasn't until the CARES Act that we started actually investing in mental health care. Because previously, we just shuttled them off into psychiatric wards, which we are still unfortunately doing to this day. So, you know, the fact that, you know, historically we've seen this long sort of view of how we value disabled lives. Think about how we talk about care and disability today. Oftentimes when we talk about care, we talk about the disabled person receiving care, right? Not thinking about the fact that disabled people also provide care. And so oftentimes we talk about disabled people as the ones that need to be taken care of, you know, like we devalue sort of their importance in this care economy. One of the things that we found in some of our research is that a good proportion of folks who work in the care economy have a disability, disproportionately so, particularly in places where you don't need specific training. So personal care attendants, oftentimes there are individuals who are either dealing with their own sets of traumas and ills that have been set upon them by you know, the various structures in society. They're also doing repetitive tasks, which often result in disability. We also see a lot of them dealing with trauma because they're dealing with a lot of people who are very, very sick. They may see individuals who have died. They may have seen other things. So many of them are also dealing with mental health concerns as well, right? And so I want folks to start thinking about not only how disabled people receive care, but they also provide care. Now, if you looked at me, you wouldn't think, oh, she's a caregiver. But I'm expected to be taking care of my brother who has significant disabilities. But oftentimes, people don't talk to me asking me what my experiences are providing care, because that's not the expectation right now, unfortunately. Lastly, what I wanted to talk about is that it's essential that we understand that everybody is worthy of care. Everybody can need care sometime in their life, whether you get injured, whether you get ill. You may need care sometime in your lifetime, particularly, like you said, at the beginning of life, but also at the end of life. And one of the things that we found in our research at the Center for American Progress is that disability is actually becoming more prominent in society today. Since the beginning of the pandemic, we've seen a 10% increase in disability. That's within 4 years. 10% increase. And that's not just from the aging baby boomer generation. We actually saw a huge increase in folks who are between the ages of 21 to the ages of 65. And that is extremely concerning to us, as we have undervalued and not put in enough money towards our care economy. And thus, we are also seeing a major burnout in hospitals, which has resulted also in the increase in disability and the increase in need for care. So, yeah, that's what I wanted to emphasize today, is to think about how disabled people are within this nexus of care.
Thank you so much, Via. Thank you. So I'd love for you to build off of the point that you just made about not enough investments being poured into the care economy, and just wanted to know, where should we prioritize, our investments at this point?
Oh man, there's so many places that we could put it in. But one of the things that we work on at the Center for American Progress significantly is home and community-based services. It is a lot of people think it's one specific service, but it's actually a set of services that individuals can be provided, oftentimes through exceptions through Medicaid. Medicaid, yeah. And so these set of services include things like what we generally think of as personal care attendants, right? So they're individuals who are providing care in the home so that the individual can remain at home and not become institutionalized or hospitalized, right? But it also provides case management services. It also provides job placement services and job coaching. So when you're talking about your child and that they have physical disabilities and they have developmental disabilities, we have services that can help individuals stay in the communities so that you aren't yourself having to provide all of those services during that time. Unfortunately, people are waiting months to years. I have actually been told stories of people who have been told by their doctors to start applying and getting on the list at the time that their child is born, because it takes so long for them to get that Medicaid exception. Not only that, but Medicare does not provide this service. So when you're aging and you're hoping to get those services at home, you will not receive them unless you have supplemental insurance. So these are things that, we have to put money in this, as we're seeing the increase in disability. We're seeing more people need these services, and the waiting lists just get longer and longer, and the pay gets worse and worse.
Thank you so much. Now we're going to go to Kate, who is going to talk about the consequences of women's earnings and the wage gap by underfunding and undervaluation of care work, and then we'll get into some questions for her. Kate?
Great. Thank you so much. And thank you to all my panelists too. I'm going to try to build off a little bit of what both Krishana and Mia had said, but bring some economics into it. So I think, as many people know, women have faced occupational segregation across time and globally. In fact, it's sort of one of the most consistent and persistent features of our labor market across time and across the entire world, is that women are really segregated into certain types of jobs. And one really big factor shaping this is caregiving, both unpaid caregiving within families as well as paid care work. So women's roles as caregivers is going to constrain their labor market opportunities in a number of ways, including sort of one example would be limiting the schedules and hours women can work. And so because of caregiving responsibilities that women have within their families, they may only be able to work a certain number of hours or certain schedules. For example, we know that 22% of women work part-time compared to only 11% of men. And women's socially constructed role as caregivers also really shapes the types of jobs they go into. So this has meant that women are the overwhelming majority of paid care workers. So prior to the pandemic, we knew that women make up 75% of workers across care industries and 80% of workers in care occupations. There's also a well-documented care work pay penalty, thanks to the scholarship of Nancy Fulbray, who is in the audience and speaking later, as well as Paula England. that finds for even when you control for relative factors that we think should be associated with how much a worker earns, like their education, their years of work experience, their skills, even when you control for all of those things, care workers are still paid 5% less than otherwise very similar workers. And the COVID crisis really brought to the foreground how the intersection of occupational segregation and caregiving leaves women in economically and as well as personally precarious positions. So women worked in jobs with the highest layoffs. We know that service jobs were some of the hardest hit jobs because a lot of in-person services had closed down, but those impacts were even still more so disproportionate for women. So between 2019 and 2021, women's employment and service occupations decreased by 1.4 million, while men's only decreased by 1.2 million. Within service jobs, employment decreased in some occupations where women are significantly overrepresented. So for example, one of the hardest hit jobs was things like housekeeping, where women are a huge majority of it, or nursing assistants also decreased by 150,000. So even though we had all these care needs, because people were foregoing a lot of preventative healthcare services, the healthcare sector was still also hit by layoffs. And then we also know in the pandemic, don't worry about it. Women worked in the jobs with the highest risks, particularly in healthcare and education that requires face-to-face interactions. And part of this too, I think I really want to emphasize here, is that low-wage women of color faced even more severe workplace risks due to their overrepresentation in particular caregiving positions like home health workers and nursing assistants that were given lower priority for PPE compared to clinical staff. And all of this is happening in the labor market. Women were also shouldering rising caregiving needs within their families. So early research from the pandemic found a huge gap in gender work hours. Mothers increased their work home sort of caregiving hours 4 to 5 times more than fathers did, which increased the gender gap in work hours by 20 to 50%. Caregiving needs were also really significant in multi-generational homes, which meant that Black, Hispanic, and Asian American families were more likely to face caregiving needs from both children and parents. And then, we did have a lot of remote work, but that also was not a perfect solution. So generally speaking, why workplace flexibility is good for women. Research found that the length of necessary pandemic school disruptions meant that mothers who worked remotely were actually even more likely to drop out of the labor force a year and a half into the pandemic, because I think anybody who had to deal with that situation knows it is really hard to work a full-time job while also operating a school in your home. So what has happened to the labor market since then, though? Where are we now? Generally speaking, this has been a really remarkable recovery. I don't want to diminish that at all. So some groups did lag in their reemployment, particularly women workers took longer to get back to the previous levels of employment, and particularly Black women took the longest to get back to their previous levels of employment. But they are at their previous pre-pandemic levels of employment now. They have been for about a year. One really important trend that has happened has been the incidence of job switching. So there's historically high quit rates as well as historically high job opening rates. So this gave workers the opportunity to really change their jobs. And we know from research that job switching is where people see the biggest wage gains. Historically, women have had a higher incidence of job switching, but this generally was due to lack of internal job letters within workplaces, inadequate job quality available to women, or hostile workplaces that women faced. But this is sort of the better type of job switching, that there are better opportunities available, and we know that workers are able to leverage this, and that led to wage convergence in the pandemic due to that job switching. And so research has found that prior to the pandemic, men and women's wages were increasing at similar rates, but since the pandemic and this convergence of wages, women did gain from that, though gender wage gap has decreased by 2 percentage points in the past 4 years. We also know that Black workers were also able to leverage this tight labor market, and the Black-white wage gap decreased by 5 percentage points in the past 4 years. And one thing I want to emphasize here too is that these changes are really due to market forces, because it's been such a tight recovery and not due to policy changes. But those market forces are sort of limited in how long they can persist to lead to those outcomes. And then finally, sort of more relevant to today's discussion, what is happening now in terms of this nexus of occupational segregation and women's roles as caregivers? I think, economists are still trying to figure that out. We're still sort of in the thick of it, and data is still coming out. But we can look to other research to try to start to estimate what we think happened here. So one way is to look at the likelihood that workers switch out of occupations. And we know that healthcare workers are much less likely to switch out of their occupations, generally speaking, due to things like occupational licensing, as well as corporate consolidation in healthcare sectors. So think of a consolidated hospital system. It's much harder for those women workers who are working as nurses to switch jobs because there's just no other employer to work in their geographic location. And in terms of family caregiving, while those intense caregiving needs facing women and families have subsided, we know from research that even when women do have increased earnings, when they do have more opportunities, that has not necessarily translated into more egalitarian caregiving within their homes. And so, while those intense needs have subsided, and women may have been able to leverage some of that job switching, that does not necessarily mean their caregiving responsibilities in their homes will change. So they're still going to face those constraints I talked about at the beginning that's going to limit what types of jobs they can go in. And so sort of, finally, so together these demonstrate that despite the fact that we had a really remarkable recovery, truly the most amazing economic recovery I could ever imagine from the depth of the crisis we had, these particular challenges facing women at the intersection of paid and unpaid care work really have not yet changed. So, the tight labor market is something that women were able to take advantage of, but there are limits to that. Competition does not solve for structural inequality. It just alleviates it while the strong economy persists. But that heat in the post-pandemic labor market can really only ever be temporary.
Thank you so much, Kate. Yeah. So one of the things that, we have been at IWPR, we've been tracking this week is this cut of childcare funding in the DC budget, Mayor Bowser's budget, and folks are really upset about this. We recognize that this is just a budget proposal. I think the city council has like 70 days, if I'm not mistaken, to pass it. But wanted to ask you, Kate, this is just another example of where we see policymakers make trade-offs when it comes to not only policy priorities, but also what they decide to fund, right? And the budget is really a statement of values for a decision maker. And so what do you think needs to happen or needs to shift when it comes to the policy paradigm around these issues?
Yeah, thank you so much. And some of this, I was thinking this when Mia was talking about what do we value and where do we see the value that people contribute to society. And so a lot of policymaking really has been focused on a really narrow definition of where does economic activity come from, where does economic growth come from, and that attention is really sort of maintained a really specific narrative of what a strong economy looks like that misses a lot of sort of what my other panelists were talking about. So particularly looking at things like a lot of focus at the federal level has been on manufacturing and climate mitigation. I also at local levels, I think they look at the type of economic investments that match a very narrow definition of economic growth and activity. So a lot of investment has gone to largely male-dominated fields. Even when there is an effort to ensure women have access to those jobs, it's sort of difficult to overcome those patterns of occupational segregation, particularly when we're not thinking about not thinking about the types of supports women would need to get into those types of jobs. I think we've seen time and again with the best of intentions when we initially see these policy pushes to generate more economic activity and growth, there is a initial discussion of making sure that care is a part of that, and it's always the first thing that gets cut. And so I think we've seen a lot of that happening in the past few years. And so, I think the DC budget is a good example of that. There's a huge recognition in DC that caregiving is very expensive in DC. Care work is very poorly paid in DC. Care workers are some of the lowest wage workers. We're in a high cost of living city. There was an initial recognition as the pandemic subsided somewhat that we need to make sure we're investing in that in order to ensure that people can go back to work and make sure that their families are cared for while they do that. But then it is the first thing that gets cut once you hit a budget crisis. So I think that's sort of what we've seen is this attention to traditional ideas of economic growth that limits sort of our long-term resiliency.
Great. Thank you so much, Kate. So want to be mindful of time. I could sit up here and talk to you all day, but we do want to make space to have Tiffany come up to the podium where she will be focused on how the consequences of the underfunding and undervaluation of care accumulate over the life cycle.
Thank you so much. So are you able to tee up my slides? There we go. Okay. So first, I want to say what an honor it is to be here joining this distinguished group of panelists and all of you. As Dr. Taylor mentioned, I'm a proud IWPR alum myself, and this really feels like a kind of homecoming. I want to give you a little bit of quick background on the Women's Bureau. We are a small agency located inside the Department of Labor, and we're the only federal agency with an explicit mandate from Congress to advocate on behalf of what is now a group of 77 million working women. And as part of our research and policy analysis work, we pay close attention to women's earnings and employment and the impacts that caregiving and other factors have on women's economic security over the course of their lives, all of which, of course, have bearing on women's circumstances as they reach the end of their working lives and into retirement. And as we've heard from other panelists, we know that care work is undervalued and care workers are underpaid. Women, and particularly women of color, are overrepresented in these underpaid jobs, which contributes to the gender wage gap. A recent Women's Bureau report found that in 2023, Black women lost $42.7 billion, and that's billion with a B, dollars, and Hispanic women lost $53.3 billion in wages compared to white men due to the impacts of segregation by occupation and industrial sector. And the gender wage gap persists among all age demographics, but tends to widen over time. So women ages 25 to 34 had one of the smallest wage gaps of about 11%, while those ages 55 to 64 had the largest wage gap of almost 23%. And it's not just gendered sorting around paid work that puts women at economic risk over the course of their lives. Another factor that impacts the gender wage gap and earnings gains over time is women's unpaid work, particularly caregiving for children and elderly or disabled adults. The lack of care infrastructure, including caregiving supports and paid leave, forces women and families to make untenable choices between providing care for their loved ones and maintaining economic stability for their families. And the impact of unpaid caregiving is evident in the data, as you can see in the chart here. While labor force participation for mothers increases with the age of their child, the labor force participation rate for fathers sees very little variation, with over 9 in 10 fathers participating in the labor force, regardless of the age of their youngest child. And while the majority of employed mothers work full-time, they are much more likely than employed fathers to work part-time, about 19.5% versus 4.4% for fathers. Not only are women more likely to leave the labor force or drop to part-time in order to care for families, they also report being more likely to pass up promotions or to ask for reduced responsibilities at work. Gender disparities in unpaid care for children are essentially replicated in care patterns for adult family members too. 3 out of 5 caregivers of sick, elderly, or disabled family members are women. Women caregivers are less often employed, 58%, than men caregivers at 67%, and work fewer hours per week on average than men caregivers, 33.5 versus 38.7 among those who are employed. And caregiving responsibilities don't end as women get older and move towards retirement. You could argue that those responsibilities actually start to ramp up. You can see in the slide that women aged 55 or older account for more than 1/3, or 35.3% of all people providing unpaid elder care on any given day, and 1/4 of people providing any form of unpaid adult care. They also account for about 8% of people providing unpaid childcare. Never wants to cooperate. There we go. Women's employment patterns and characteristics make them more vulnerable to unexpected economic shocks and less well-positioned to fully recover, a particularly stark reality for women with fewer working years ahead of them to recoup losses. This generally predisposes them to less economic security and greater risk of poverty, not only in retirement, but at all points along the life course. In the short term, informal caregiving can affect current earnings and health insurance coverage if caregivers take low-paying jobs, reduce their work hours, or leave their jobs altogether. In the long term, caregiving can affect retirement savings, Social Security benefits, and survivor benefits, and employer pensions. And projections from our 2023 report on the lifetime effects of providing informal care suggest that the average mother, now ages between the ages of 39 and 43, can expect to forego about $295,000 in earnings over her lifetime. And this estimate is composed of $237,000 in lost earnings to care for children, parents, in-laws, and spouses, and $58,000 in lost retirement income from Social Security and employment-based retirement plans over a lifetime. And bear in mind, this is an average. For some women, that number is much higher. So what are the implications for retirement? Taking time out of the labor force or working part-time for caregiving reduces women's ability to contribute to Social Security and other retirement plans. And because women generally earn lower wages than men because of the gender pay gap and occupational segregation, even if they put the same percentage of their income toward retirement, they save less money. Women also live longer than men on average, so they must stretch less money over more years and often incur higher medical expenses as they age. And so for all these reasons, women are more likely to live in poverty as they age. 11.2% of women 65 and older live in poverty compared to 9% of men. And that risk increases as women age. So 13% of women 75 and over live in poverty compared to about 9% of men. And again, this risk of poverty extends for the duration of their lives. So the inequalities that women experience throughout their working lives accumulate, they interact, and they're compounded over time. We often talk about the immediate impact of things like the gender wage gap, the lack of affordable childcare, gender and racial discrimination and harassment, because those negative effects are felt immediately in lower paychecks, less economic security, and more difficulty affording the basics, and by undermining women's basic health and safety. But there's a longer-term impact as well. A lifetime of lower wages can mean needing to work longer past the standard retirement age in order to make ends meet. A lack of childcare and other caregiving supports can mean more time out of the labor force, lower lifetime earnings, and less economic security. Thank you so much, and looking forward to answering some questions.
Thank you so much, Tiffany. So one question I had for you is, just wanted to have you expand a little bit on the consequences of women's retirement security. Would love to hear from you too what the racial breakdown is when we think about those numbers around poverty for women.
So this is an area of real concern. Is that working? Okay, good. This is an area of real concern for us at the Women's Bureau, thinking about women as workers over the life course. On average, a woman retiring at age 65 can expect to live another 21 years, more than 3 years longer than a man retiring at the same age. And not only are older women more likely than older men to be impoverished, but they also have lower incomes overall for the reasons I discussed previously. And this has prompted us to do a lot of work to look at the income sources for older women, kind of what are their experiences as they're moving towards retirement. On average, women 65 and older have an income of about $31,000 compared to men 65 and older with an average income closer to $55,000, meaning that women ages 65 and older are only working with about 43% of the income of their comparable male counterparts. And then there are also differences in the sources of income for those 65 and older. And this is the result of research that we did last year. In 2023, over half of Social Security beneficiaries 60 and older were women. 63.3% were beneficiaries ages 85 and older. And Social Security, we found, is the largest source of income for women 65 and older and accounts for about $11,000 in their income, or about 37%. So these are real concerns.
Thank you so much. So now we're going to shift to audience questions. We ask if you have a question to please state your name and organization if applicable, and please be sure to speak up and into the mic clearly so our friends online can hear you all.
Good morning. Thank you very much. My name is Eurydice Fotopoulou. I am from the IMF, but I don't represent the organization here. I had a question for Kate, please. You mentioned job switching. How do you measure that? What sort of data is available for this? Thank you very much. Very significant contributions.
The data on job switching I was looking at is sort of typically the job opening and labor turnover survey that the Bureau of Labor Statistics releases measures job openings, quit rates, things like that. That is that. But the research that's on the way in which wage convergence, job switching is shaped wage convergence, I believe that's what the current population survey. It's the Otter, Dubé, and McGrew paper that's on NBER. But afterward, I'm also happy to talk to you about job switching data after this.
Thank you, Kate, and thank you for the question. Anyone else? Oh, and then we'll get to the back.
The Mary Popper papers. And I guess it's an aspirational question, not looking for an answer, but maybe a conversation. What if we could imagine, or what would an economy that is centered around care look like as opposed to one that is centered around profit?
Great question.
Yeah, I will say, so it was interesting because the charge for the papers, and it was, I mentioned a collaborative of funders, and the papers were originally written to be an internal document for that collaborative to get on the same page around their funding priorities. And so they were interested in the two populations, African American population and the Native American population, and really interested in the role of racism and sexism. And at the end of writing these the papers, there are two, as I mentioned, kind of the historical piece and the policy and solutions piece. My colleagues and I sat down and really kind of had the aha moment that capitalism was really a big part of the issue and the problem. Duh, right? But it's not in the papers because it was the aha moment after everything was written, right? But that certainly is kind of where we landed. So I'm glad you raised the issue. Thank you.
Can I break in?
Yeah.
I 100% agree. How do we figure out a way to switch our economy to more of a care economy and less of a capitalistic economy? I think one of the things that we should look at in particular is the mutual aid that was provided throughout communities during COVID. That is one of the best examples that I can see that was really about providing care within a community. And we actually see this amongst a lot of racial minorities from, African American, Black communities, Native populations, and Asian Americans and Hispanics, right? Where there is this belief that we give back to our community, that we provide care for our elders, we provide care for other people's children in the neighborhoods and stuff like that. And so I think we have examples. It's just that we have leaders who are not interested in that. And how do we actually, get folks that can become leaders within our government, within our communities, that can really push for a change in priorities, because that's what it has to become, is a reprioritization of our values and a belief that every human has a right to be here, and how do we provide mutual aid within our own communities.
And then I'm just going to build on that a little bit. Thank you so much for this question. You clearly got us all very excited to talk about this. And as Mia was talking, I was thinking of research by Nina Banks, who's an economist, where she talks about Black women's unpaid community work and the way that that is creating a real economic value that is not recognized, typically speaking. And I think there are ways that economists could creatively measure this. I don't think it's outside the realm of what economics does, because Nina Banks' work sort of makes the point that when this community care is done, when this mutual aid happens, that is creating a real economic value to those communities. It is sort of not necessarily in dollars and cents, but one could project, dollars and cents onto that. And then I think we need to think a little more broadly of what is an economy for? What does an economy do? There's a wonderful paper called Social Provisioning as a Starting Point for Feminist Economics by Marilyn Waring. Anyone, I'm happy to talk about research after the session. And I think that's what we need to think about. The fundamental role of an economy is to provide social welfare for people. And what does that look like? I think it just requires economists to be a bit more creative in how we measure value.
Thank you so much, Kate. And I think we had 2 questions back here, and then we'll come back up to the front.
Julie Cashin from the Century Foundation. I wanted to ask if you guys could talk a little bit about, really helpful talking about the grounding in the history, really helpful hearing about childcare and home and community services. Could you talk a little bit about how paid leave, paid family and medical leave, paid sick days fit into the equation, and also reproductive justice? Small question. Thanks.
Who wants to start? It looks like Tiffany. Go ahead.
Yeah, I mean, the paid leave, can people hear that one? Yeah, okay. The paid leave piece is so critically important, right? I mean, we know that most workers simply don't have access to any kind of paid sick days, even short term, certainly not the kind of long-term leave that's needed to care for a newborn, an adopted or foster child, their own needs. And so when people cannot take time off of work, first of all, it's associated often with these lower wage jobs. They are much less likely to have that leave, so it reduces the quality of those jobs. But this is should be a basic right for us to care for ourselves and our family members. I think about it in particular, one area where it's not talked a lot is this issue of hospice. As hospice is moving into more widespread use, the expectation is that it is unpaid family care that is providing most of that. When folks go into a palliative care scenario, sometimes over a period of months, nurses will pop in and out, but the expectation is that it's families providing that care. And it just creates a really untenable circumstance when people are forced to make those decisions.
Thank you. Anyone else? Kate?
I'll add a little bit, and then I will try to talk less after this. But no, I love this question, and the way I think about all this suite of policies we need is that we really need all of them if we're actually going to give women equal access to opportunities. And so if we think about, someone bringing a new child into their home, yes, they need paid leave for when the child first enters the home, but it doesn't stop there. In order to actually be able to raise children, you also need sick days for when your kids get sick. You also need affordable childcare. You also need flexible work schedules. It's like you can't do just one of these things because of how care actually works over the life cycle. And so I think all of these policies are really needed in tandem to make sure that, we should have, women and men should have equal responsibility for caregiving, but in the world in which women still have the primary responsibility, these are all needed in tandem to give women that equal footing.
Yeah, and I just want to thank you, Julie, for bringing reproductive justice into the conversation because, we're all in a situation where we're in the midst of, the fall of Roe versus Wade and, access to abortion and the full spectrum of reproductive health care is closely linked to a person with the ability to get pregnant, their ability to thrive and, earn high wages and support the families they already have. So it's closely linked to these conversations around economic security. And it's also something that IWPR is engaging in quite seriously these days across a host of our programs. And we'll continue to sound the alarm on how, these bans on abortion are hurting women in this country. Any other questions? We have one over here. Oh, I'm sorry. Can we come up here first? I want to honor this gentleman who did have his hand raised, and then we'll go back there. Thank you.
My name is John Wisman. I'm a member of the economics department here at American University. From the 1930s until 1978, is this working? From the 1930s until 1978, there were major political figures that supported guaranteed employment at working wages, at living wages. And it's at 68%, according to a recent poll, of Americans support it. Yet it is not supported, or it's not part of the platform of any major political party in the United States or in Europe. And my question is, to what extent is this being considered by those that are doing care research and advocacy, and how much difference would it make in terms of care?
Kate, you want to take that?
Well, I said I wasn't going to talk, and then you asked about jobs guarantees, essentially. And I think that some of what you're talking about is like a jobs guarantee. Is that correct? Yeah. Yeah. Yes. So, I mean, some of what I was talking about with people's ability to switch jobs, what kind of jobs can they switch to, the role of being able to switch jobs to have better opportunities and more bargaining power, something like a job guarantee would do precisely that. It gives people a range of access to broad opportunities. And so even people who don't take advantage of the job guarantee program also would do better because they have that outside option. The degree to which it's considered, I mean, I think the problem with this in terms of sort of mainstream politics and policymaking, it's very expensive. But the benefits of it is the types of jobs where we know we have the greatest shortages are caregiving. And so when people have done modeling of these types of programs, it's a significant amount of caregivers who we know would be paid if it's through a public job guarantee program at a fair living wage. And so I think both it would have all these positive effects, in particular for caregiving it would, because a lot of those jobs would be care jobs themselves. That's where the greatest need is. But in terms of the sort of political possibility, that's where it gets hard because it's just very expensive. If you look at how many unemployed people there are, as well as employed people who'd prefer to go into those living wage guaranteed jobs, it's hard. Do you have an answer to this too, Mika? I want to comment on this. Okay.
Thank you. So Nancy Fulbright just had an important report come out on this, but I just want to say, that part of the problem here is the accounting. So that because the system of national accounts makes, the contributions of the care kinds of, the unpaid care kinds of work, invisible, then we don't see the benefits of that, right? So then when it moves into the paid sector, it looks expensive, right? But we're not seeing that we're already paying the cost and consuming this, right? And so I feel like the accounting, really sorting out our accounting, which sounds so boring and technical, is a really important political tool in arguing for this because it makes visible the contributions of, these things are already making to the economy. I'm sorry, I'm Mika Muirs from the Department of Economics at American University.
Can I also add something? I think one of the things that a lot of folks don't think about, particularly when we talk about jobs guarantees, is how is that going to impact disabled people? Right now, disabled people are one of the least employed populations in the United States today. You add on race and gender, that impacts it even more. And the thing is that when we do employ disabled people, we often undervalue them, right? We actually have this thing called 14C, which is an exception for paying even minimum wages to disabled people. So we would have to ultimately shift, again, our values, right? Which is hard to do when a lot of people who are at the top, who are making the decisions, have the money, right? They have the political power, they have the advantages. And so it's very hard to show, the importance of the things that so many communities understand that we need. And so I think it's a real push for, communities to continue to think of not only ways to ensure that they get the resources and get the people who need to be at the top, but also rethinking how we value human beings and their work, and also how we value disabled people as well, because, you know, if more disabled people can become employed, they're going to need less care. So many individuals are stuck on SSI, SSDI, Medicaid, Medicare, because we don't have a good healthcare infrastructure, right? These individuals who are reliant on Medicaid to keep them alive, to keep them in their communities. They have to choose between getting a job, staying on SSI, which is literally below poverty accounts, and getting Medicaid, because their care is so expensive, because we undervalue our healthcare system. So I think it's a real reimagining. And I think we have the people there that want to do this. It's just getting them into the right rooms and ensuring that we continue to build ladders to the next rung of people to ensure that their voices get heard.
Great. Thank you so much, Mia. We do have to end there. What an amazing conversation today. Thank you all. Let's give a round of applause for the panelists. So before I pass things back to Robin, just want to encourage you all to continue to engage on these topics and more, both as you're networking throughout the day as well as on social media. And we look forward to engaging with you all for the rest of the day. Back to Robin.
Thank you. Thank you. Yes. So can you guys hear me? We're going to be saying that all day. So again, I just want to thank Jamila, Krishana, Mia, Kate, Tiffany for a wonderful, and important panel. I think, as you can see with the questions, that I think everyone is engaged, and I find that it was really key on how this was kind of weaved together, that we could see the history of kind of care work and how these racial and ethnic disparities and complications are interweaved throughout, and that we're seeing how they're impacted by COVID and worsened and so forth. The impact of care on occupational segregation, how it affects caregiving and lost wages, and it's just a complex issue. But I want to say, and I know I'm taking a little moment, I want to say this last part is that I appreciate the question. I think earlier I said that care is the cornerstone of economic activity, and I think the question earlier was like, how could we make it maybe the keystone of economic activity? So I appreciate that. But now on to the business of why I was standing up here. It's to close this out. So again, I just would say, let's give these wonderful women a hand. So we went a little over. So right now we're about to enter into what would have been a 20-minute, but it's like a 15-minute break. And so there are coffee and refreshments in the reception hall. As you can see, they put everyone at IWPR to work. So you'll be seeing me throughout making these connections and these comments. And I am going to continue to remind you to participate in these brief interviews and so forth. This is an opportunity to kind of bring up these topics and so forth and capture them. And you'll see Will and Susan over there. Those are the individuals who will talk to you about that. As Jamila said, we want you to, engage online with this conversation with the hashtag IWPR research. That's one R in the beginning, and hashtag care conference. And then following the break, we will have two parallel sessions. That's at 11:35. The first workshop, Challenges of an Aging Population, Retirement Gaps, and Elder Care, is going to be in break room 113. And then the second workshop, The Undervaluation of Care in the Human Services Sector, will be back in this room. All right, thank you. So I'll see you guys back then. Okay.
Shake your hand.
Okay. Hello, everyone. Thank you for joining our panel. My name is Dr. Jennifer Turner. I'm a senior research associate at IWPR. And this panel is, sorry, my notes are kind of like a mess. The undervaluation of human services, of care work, in the human services sector. And so I'm going to start by introducing our panelists. I just realized I don't have a page of my notes. I'm so sorry. So actually, I'm going to improvise for a second. Do y'all mind introducing yourselves? Because I don't have a page of my notes. Okay. All right. So I'm going to start with Dr. Nancy Fulbright. Go ahead.
Hi, everybody. I'm really happy to be here. I want to begin by building a kind of bridge between the last session and this one by asking you a question. Is care undervalued because it is primarily provided by disempowered groups, especially of women of color? Or are disempowered groups concentrated in or relegated to care provision because it is undervalued? This is not an either-or question. The two go together, and I think understanding the way in which they reinforce each other is really key to our project. So what I'm going to dwell on is the second part, the second possibility, looking at how the devaluation of care provision itself is a force in reproducing gender and racial inequality. But I just want you to be aware that I'm really emphasizing the circularity of these two different approaches. And I do come at this as very much as an economist who's critical of market dynamics. And I believe that care is undervalued for two really important reasons. One is it has many of the characteristics of a public good. It spills over in ways that benefit many others besides the direct recipients. And that makes it very hard to capture the value of care provision in a market-based economy that's based on kind of per unit prices and the way they affect supply and demand. And then a second reason for its undervaluation is basically the people who need it the most are least able to pay for it. So these are arguments about the undervaluation of care that are very directly related to reliance on the market economy and the logic of capitalist exchange. So I'm needing my next slide, my slide. Yeah, so virtue is its own reward. That's kind of the way in which economists think about the undervaluation of care provision. And instead, I want to emphasize the high price of doing good. Next slide. So kind of an overview background. Employees in care occupations and industries are paid less than comparable workers in other jobs, even other care jobs. And this is because they provide social benefits and public good, and their commitment to the well-being of their clients also reduces their bargaining power. Okay, social assistance workers are especially disadvantaged because their clients have little political voice and are often culturally stigmatized. So this is the point about people who need it most or least able to pay for it. But also, increased subcontracting to private firms has been a cost-cutting strategy in the public sector that has put downward pressure on wages. So here are some basic trends that are relevant to the numbers. There's been declining unionization of workers in social assistance occupations from 24% in 1984 to 11% in 1984. There's been increased subcontracting out of the public sector. 58% of workers in social assistance were in the public sector in 1980. Now it's only 25%. For both men and women, earnings relative to other industries have declined since 1980. That's what I mean by the high price of doing good. And today we're facing major staff shortages and really high turnover in the sector that's contributing to the larger care crisis. So just to be clear, within the social assistance category, there are a bunch of different categories: individual and family services, community food and housing, and emergency services, vocational rehabilitation services. But these are obviously going to groups that are very politically and economically disempowered. And we focus on these particular subcategories in the social assistance industries, and also look at some other care workers employed in health and education. And we use some data from 2015 to 2019, pooled over those years from the American Community Survey. And we focus just on full-time, full-year workers, just as a first cut at looking at what the penalties are. So in these industries, these social assistance industries, 75% of the workers are women, compared to 40% in non-care industries. 21% are African American, compared to 11% in non-care industries. 42% have a bachelor's degree. So actually pretty well educated relative to the overall average. 45% of them are employed in nonprofits. So nonprofits are really dominating this sector today. 25% only in the public sector, and 30% in for-profit sector. So here are just some numbers on annual earnings of full-time workers with a bachelor's degree, because we want to control for education and just look at comparisons across those with a bachelor's degree. So in social assistance, we're talking about in 2019 dollars earning $42,000 a year. In other care services and health and education, $52,000. In non-care industries, $70,000. So just those descriptive statistics kind of make the general point. But to kind of dig deeper, we want to do some statistical analysis and some regression analysis looking at controlling for a lot of different characteristics, both race, ethnicity, citizenship, gender, and so forth. And what we see is that overall, among workers in care service industries, the penalty is about 11% compared to non-care industries. Banking and finance is a good example of a non-care industry. Social assistants are earning 23% less than workers in non-care industries like banking and finance. within social assistance, nonprofit employees are earning less than for-profit employees, and public sector workers in healthcare and education pay the greatest penalties. But in social assistance, what's really distinctive about it is the pay penalties are largest within the nonprofit sector. And basically what's happening is there's a selection process that people that really want to help others are willing to take a pay cut to go into this industry. But then what they're finding is that the pay penalty is making it very hard for them to sustain their commitments. And as a result, we see pretty high turnover and pretty serious problems with labor shortages and quality issues in social assistance. And these have really big kind of ecological consequences for poor communities that contribute, I think, to a lot of problems on the community level that we should think about in the same way that we think about the healthcare of individuals. We should be thinking about the healthcare of communities and recognizing that the underpayment of social service workers in these industries is really actually quite costly to society as a whole in terms of its consequences for entire communities. So if you're interested in seeing the numbers in more detail, feel free to contact me. I do have, with my co-author, a draft of a paper. Hopefully it will be peer-reviewed and accepted for publication in the near future. And in the meantime, it would be great to get any comments that you might have on it. Thank you so much.
Thank you. So next we'll be moving on to Arjan Hagovich, who will be talking about unequal pay for equal worth, demonstrating the undervaluation of human services work using comparable worth principles.
Thank you. Is this on? Thank you so much. Thank you so much, Nancy, for this introduction. I'm going to be a bit more niche, but before I start, I also really want to call out Lauren, who is funding our work and making it possible for us to dig in more deeply into these connections of who does the work and why is it so underpaid.
The Kellogg Foundation.
Right. And this project and this presentation, in a way, comes out of a very proactive way of trying to raise pay for human services workers, which brought a lot of us on this panel together. And Jenny Romick led that project, and she will say more about it. So as I said, I'm going to be a bit more niche, but also going to look at the undervaluation of human services work from a comparable worth perspective. And the reason we're looking at this comparable worth perspective is because in the UK, using this very niche kind of technical way has been used to really revalue or try and revalue care work in the public sector and to some extent beyond. And it has done this by involving workers and unions and organizing around care. So very quickly, we've already heard a lot about the facet of effect of occupational segregation in the United States. Something like 4 in 10 women and 4 in 10 men work in occupations where they are the large majority of the workforce. And I think it's also important to remember that, you know, this isn't just in occupations, it's in industries. And in industry, you would expect more of a mix of workers. But in fact, as we know, in healthcare and social assistance industry, almost 4 in 5 workers are women. And in construction, about 9 in 10 workers are men. And construction is the sector which receives generation high levels of federal funding. So part of what we are also hoping to do is discuss how we can balance this out. So this issue of the undervaluation of women's work in almost all other high-income countries is recognized as pay discrimination in law. In the United States, we have equal pay for equal law. Elsewhere, and including in Canada,
but also all of Europe, Australia, all high-income countries, and some middle-income countries. Pay discrimination includes a prohibition of underpaying people for equal value. And that's really what we also were trying to reflect in our project in Seattle. How do you operationalize that? Through job evaluations, typically in organizations that's already very established. If you think organizations have lots of different jobs and they need pay relativities, you can't just rely on the external market. Historically, though, just because you have a job evaluation which looks at different elements of a job, if you think you compare apples and pears or apples and oranges, you weigh them, you look at nutrition, you look at how much sugar is in there, at the size, whether they make children happy, whatever, right? There are lots of different ways. So that's the same with job evaluation. And these can, of course, be biased by thinking somebody picking up trash as a trash collector works in much dirtier environment than somebody who works in a hospital and has to deal with human waste. So what we worked with somebody from the UK, from a union, they have for 1.6 million workers there, they developed a gender and racially reviewed, hopefully unbiased job evaluation. And the factors that are used to break jobs apart are effort, initiative independence, skills, environment, responsibility, and you see knowledge there, but importantly, knowledge is not measured by degree typically, but what you need on the job, because historically, men have kind of said, oh, I've got this thing, pay me more, right? But it had nothing to do with the job. Now it's switched a bit now. Women have to get educational attainment or show it for every little step of the way. However, job evaluation is deliberately kind of marginalizes, if you like, formal attainment that you need. And as I said, this scheme was developed with unions and external experts. And just to give you an example, too far. Okay, here is one example. And when Jenny comes, she has a beautiful QR code, so you can probably read it better if you look at the QR code. So this compares a teaching assistant, which really is a childcare worker, early childhood worker in the nonprofit sector in Seattle, with a public sector administrator also in Seattle. And these things are set up by interviewing a lot of people in detail about their job. And as you can see, firstly, if you can see, right, you probably can't see. The teaching assistant was paid just under $40,000 a year, and the administrator close to $80,000. However, her overall score on the job evaluation is higher. And the particular bits where there are differences, this not, no, I just wanted to highlight to use the laser. You can see there on knowledge. If you work with children, typically there are lots of regulations. You need to recognize signs of well-being or lack of well-being. You can see where the job scores higher is also on physical, mental and emotional demands. Physical demands, we get this a lot, trying to get women into construction, saying, oh, they're too weak. If you lift up a child, you have to do quite a bit of lifting, crouching, playing with them. And then there's the stress of supervision and being responsible for young lives, but also interacting with the parents. So they're not too different overall, but different on some regards. However, the pay is vastly different. So question is, okay, what do we do with all this? What's it relevant to anything, right? As I said, in the UK, firstly, it is implemented, and because they have comparable worth value, the wages of care workers were increased substantially. But importantly, it was also a organizing tool to help people see the value of their work. And these interviews that are being conducted with job holders, a lot of them, you need to train them almost before so that they see all the facets of their jobs and don't just say, oh yeah, I play with kids, right? So the second one is, can we use equal pay? Can we use this concept within US laws? Some of the states are trying to move that way. In the state laws by having equivalent and equal way. We don't quite know yet how this will work out in practice, but there have been attempts to get this anchored into law. Can this inform collective bargaining? There has been in Europe, big issues pushing unions to look at different groups of workers that they represent and getting them to negotiate for more equal bits. And here, actually, there is a case going on where this kind of fits in, which is wardrobe organizers in the film industry and stagehands and set designers, right? And you can imagine who are the women, who are the men, and who gets paid more. And lastly, question is, can we integrate such a perspective into public procurement processes in supportive states and local authorities? Can we do something, say, construction-related, care work-related, and how can maybe do this? So these are just questions for the future. And now I hand back to Jennifer.
Thank you, Ariane. So now we will move to Sarah Butts. And Sarah, I'll let you introduce yourself if you want, but the title of Sarah's presentation is The Undervaluation of Care Work in Human Services, Advocating for the Social Work Workforce.
Thank you so much. And thank you for having me today. This is awesome to be here with you all. I'm the Director of Public Policy at the National Association of Social Workers headquarters office here in Washington, D.C. We have 55 local chapters that also work on our state legislative agenda. In my unit, we work on the policy advocacy, mostly with Congress, the administration, federal agencies here. But we also have a PAC, and we do the campaign side of the work. So I won't be able to get through everything here, but I'm glad to talk to any of you that are interested. So really quickly, NASW has one of the largest policy portfolios of any DC-based organization. We advocate for the social work workforce, which is really advocating for caregivers across the country, as well as a whole array of social justice issues that really range from cradle to grave. This is a huge task because policy advocacy requires deep expertise and understanding of detail. The progress that we can make here in this town especially is incremental and is largely dictated by the external environment. Just want to emphasize that if you're interested in our policy work, our whole agenda is detailed in this 2021 Blueprint of Federal Social Policy Priorities. I'm really going to talk a lot about some of the work that we're doing around the workforce. And just want to emphasize that sometimes folks can get discouraged in the political environment that we're in to say that we can have a positive impact, whether we have a friendly administration, supportive Congress. There are opportunities to make progress, and there's opportunities to fall back, and we cannot lose sight of that as we try to translate our research and advance our policy agenda. Okay. So really quickly, first thing that you need to advocate for a workforce or for our clients in the communities we serve is data. And unfortunately, for social work, we don't have great information, you all. Even I've met numerous times over the last 5 years with HRSA, with the Department of Labor. The federal data that we have on the workforce isn't great. Social workers work across many different settings with different associated scopes of practice. We're trained at the bachelor's, master's, DSW, and PhD levels, and this is a critical need. So we need scholars to study about social work, where we work, the impact that our services are having, particularly if we're saving money or increasing or improving health outcomes or well-being. That's what Congress wants to hear. And so I want to talk a little bit about the information that we do have to kind of give some context. But you'll see that if you look at social workers, it's consistent with what we're hearing here. 86% majority female profession, that there's consequences of that. And we also need men in the profession. There's about 700,000 social workers in the country. About 250,000 of them are clinical social workers. That is, they have a master's degree and have met the postgraduate requirements to practice independently. Almost all of those postgraduate requirements in social work come after the master's program at the expense of that social worker. Their supervision is unpaid. Their field practicums are unpaid. They have to pay for CEs. They have to pay for multiple licensing exams, all on the backs of the practitioner. So it's very difficult to get from high school through the education that you need to be a professional social worker. We don't often kind of toot our horn, I guess, but we are a pretty diverse workforce already, particularly in terms of incoming new social work graduates. We have high percentages of aspiring social workers of color, for example, who are bilingual. But we also have as much as 46 or 41%, something thereabouts, of new first-generation college graduates in the profession. And there's an economic consequence of that. And so we need to use this data to justify the investment in our workforce. We're already doing some of the things that say Congress says they want to attain with a provider group, but we don't have sufficient support. Okay, here we go. Where am I supposed to point? Okay. I think I missed a slide. Okay. Median pay around $55,000. Starting pay closer to $47,000. We have obviously social workers that are salaried employees and some that are receiving insurance reimbursement. Both sides, there's problems. We have whole entire child welfare workforce where as much as 20 to 40% turnover in those positions, and we have a significant amount of student loan debt. About 67,000 is what the data says for new graduates for a bachelor's and a master's degree. But we know that our students of color have much more. I think it's around 90,000 for our Black students that are new grads. And to put this in perspective, I helped to facilitate 2 social workers testifying before the Senate Banking Committee in the last Congress. One had over $200,000 of student loan debt and had never gone to a private school. So significant challenges with lack of investment in student loan debt relief, as important as compensation. So I'm going to try to give you some examples of the structural problems and the challenges we have with advocacy by focusing on Medicare. Folks say, why do you focus on Medicare? Well, that's because Congress has authority over the Medicare program. In Medicare, their clinical social workers have been providers for many years, since 1989. But our reimbursement is 75% of the physician fee schedule. With that in perspective, psychologists are paid at 100% of the physician fee schedule, sometimes for the same service, which is the case for psychotherapy. NESW has been working on this issue for well over 10 years. There's been a bill in Congress probably for 15 years in related advocacy, getting these bills reintroduced every single Congress. We still have not passed these provisions. And there are problems associated with our scope of practice in that it hasn't also been reevaluated since the late 80s. Our definition in the Social Security Act is limited, which means that we're not able to practice at the top of our scope, which precludes us from billing a whole array of services that would be useful, okay, to the clients and communities that we serve. This obviously impacts professional social workers accepting insurance, but definitely accepting Medicare or Medicaid. So these things need to change. When Congress passed the mental health parity bill over 10 years ago now, I believe, Medicare was not considered. So Medicare is not accountable to the parity laws that we have in place. Just want to say that one of the recent progress that's been made is that marriage and family therapists and licensed counselors can now participate as providers in the Medicare program. They lobbied and worked to advance that bill for over 25 years. and that was just passed last year, and they can now serve clients in the Medicare program as of January of this year. I keep them pointing in the wrong direction. So, there is hope, but you have to work on these things tactic by tactic, and it's a long game. NASW has been working on a bill, the Improving Access to Mental Health Act, like I said, over 10 years. Last year, 2 of those provisions passed out of the Senate Finance Committee. We're hoping that they get through in this Congress. If they don't, we'll have to start over again. But these are signs of progress. But they regard our scope. The Congress is considering adding 2 new services that we can provide. Instead of addressing a limited definition, they want to address the limitation service by service because of the cost associated with this. And we are not right now encouraged that we'll be able to get an increase in our reimbursement, and we're only asking for 10%. Senator Debbie Stabenow, a social worker in Congress from Michigan, our champion, has introduced an amendment during that Senate hearing, but it's unlikely to move because it's perceived as just a budget issue. So if you think about what it takes to really make progress, I'm trying to give you some perspective. Through CMS and their proposed rules, some of these services were included on the regulatory front, which is encouraging. And many of you may know that I did serve on the Biden-Harris negotiated rulemaking committee for student loan debt relief. That is the process that was undertaken by the government when the Supreme Court shut down Biden's student loan cancellation plan. So we're anticipating, we had a good rulemaking session from October of 23 through February of 24, and we're anticipating proposed regulations. But we need long-term higher education reform to include implementation of child development accounts to try to supplement so that we have a mechanism to support higher education costs. These are just some kind of notes. Biden's agenda obviously includes many of our priorities. Congress has passed some spending bills, but they haven't included a lot of the health provisions, so we'll be watching out for that. 2 additional items that I wanted to highlight that NASW did a lot of work on is regards getting provisions passed through a COVID spending bill, the provisions of the Employer Participation and Repayment Act. These provisions will expire in 2025, and they allow employers to pay up to $5,250 of their employees' student loans, and it would not be taxable to the employee. Now, a lot of nonprofits are not implementing these type of changes because of the cost, but these are the policies that we need to see, and we need to watch to make sure that we can get this approved and made permanent. And also that we were successful in advocating for significant changes to the public service loan forgiveness program through a waiver that helped many, many professionals get their student loans forgiven after the government essentially failed in kind of delivering the promise of that program. So I have a whole number of recommendations here, but I'll just say that we need to advocate for the workforces and the clients and communities that we serve. There are many regulatory comment opportunities. I think NASW submitted at least 11 comments in the last year. We probably could have submitted 45 because that's how many proposals are relevant to our mission. We need experts to submit comments. There's going to be a couple hearings coming up in Congress soon, one on Medicare reimbursement, one on substance use disorder services access, and there's going to be a hearing on April 10th, I'm sure, with the loan servicer, Mohila, to try to hold them accountable for servicing our loans and making sure that public service professionals have access to forgiveness and student loan debt relief. So with that, I thank you for the opportunity and look forward to meeting and speaking with some of you.
Thank you. Okay, so I'll let you introduce yourself, Dr. Ramich, but I'll just say the title of your presentation, Wage Equity for Nonprofit Human Services Workers, a study of work and pay in Seattle and King County.
Thank you, Jennifer, from one to another. Hi, I'm Jenny Romick from the University of Washington, the other Washington in Seattle. And it's great to be in a room full of fellow players in the long game. And given that we have Final Four games tonight, I'll think about basketball analogies. And, sometimes you're shooting 3-pointers and sometimes you're fighting over loose balls. But I'm here to talk a little bit about the actual policy work and good news, short-term policy victories that came out of this wage study in Seattle. I do have a QR code if you want to hold your devices up and see our clunky website. But I'll talk a little bit more about this work. This began probably 4-ish years ago when, so I sit at the School of Social Work at the University of Washington in Seattle. And as someone lucky enough to be in academia in a practice setting, I've done a lot of work with local government, city, county, and Washington State. And I got a call from somebody I'd worked with in the city government saying, we're thinking about funding this work on human services. How would you scope it? How should we think about it? And we had a few conversations, and then my colleague and I realized we should stop talking to you because we want to actually do this work. So the City of Seattle Human Services Department was convinced by years of lobbying by the Seattle Human Services Coalition, a group of executive directors of nonprofit organizations that hire these human services workers that we're talking about here. They were convinced to fund research, fund a study to accompany their advocacy. And the purpose of the study was to use a comparable worth analysis and to estimate the extent of the wage gap between human services workers and the rest of the economy. And this was a super exciting question as someone who trains social workers who are working in and often leading human services organizations. I was really interested in it. And as somebody who's always been interested in inequalities in the labor market, I was further interested in it. We were lucky enough to get a dream team of folks willing to work with us on this. Nancy Fulbray, the work she talked about here, she and her colleagues headed up what we call the market analysis part of our work. Ariana and colleagues headed up the more comparable worth inspired job analysis. And she showed the parts of that. And Dr. Krishana Lloyd, who you saw her work in the first part, was the leader of our accompanying historical and policy analysis. And we really did this work coming from the foundation that she outlined, that these inequalities are baked into our systems in ways that reflect longstanding racial and gendered and intersectional forces in American history. So anyhow, that's a lot to put on one little discussion in front of Seattle City Council, but that's how we did it. So our main findings came out of the Nancy's team's work. This is essentially the same story that Nancy showed in the national data, although the pay disparities were a little more stark in Washington State. We have a economy known for engineering and technology. We build airplanes, not well, apparently, unfortunately, these days. And we have a global logistics company that used to be an online bookseller headquartered in Seattle. And so between Microsoft, Amazon, Boeing, we have a lot of fields that are dominated by high-paid white male jobs, and then the type of occupational segregation that accompanies all those forces. So this was our headline finding from the market analysis, where Nancy's team used American Community Survey data and then also backed this up using Washington State employment data that fundamentally told the same story. There is an underpayment. It is not attributable to anything observable we can see. They did a complementary switching analysis. It's not attributable to anything unobservable we think is there. There is a real pay gap between human services workers and the rest of the economy, between human services workers and other care workers, teachers and healthcare workers. And this gap is most stark when you think about the human services workers working in nonprofits. And the comparable worth, the job-to-job evaluation that Ariana showed, really lent credibility to the big numbers by saying it's not because the jobs are different. These wage gaps are not because the jobs require less skill or knowledge. They are in spite of the jobs actually being as demanding or more demanding than the other jobs. So we did the research. Academics like doing that. But part of our deliverables were to come up with recommendations. And turns out a group of largely scholars are real comfortable having vague recommendations at the end of an article, but get really prickly and nervous when we have to make specific recommendations to city council who's actually going to read them. But we worked through that, and we did that. And we came up with a set of 7 recommendations overall. The short run ones we thought were things that could reasonably happen in the next few budget cycles. The headline one, of course, is to raise real wages by a minimum of 7%. That number kind of both fit the local inflation we were seeing, and that also came out of an analysis that the market team did looking at workers in the state employment records, state UI records, who had switched from human services to a different industry. On net, they saw about a 7% hourly pay raise a year later. The actual increase in take-home income was much larger because they also got more hours. You can read all the details on the QR, but so the 7% number we thought was both realistic and evidence-based. We wanted to make sure that that was not going to be eaten away by inflation adjustments or making jobs harder or cutting benefits. And we further urged the city to think about the role that wage inequalities were playing in larger racial and gender inequalities in the state. Seattle city government, all of the offices have a anti-racism task force, but they weren't explicitly looking at wages, which is wrong. And so we pushed them to explicitly do that. In terms of longer term, we weren't willing to put a number on this, but we did do some math for people. And we said, you know, if you have a 37% wage gap, the asymmetry in percentages actually mean you need more than a 50% increase to close that. And so we said, you know, this can't be a one and done. We really, to actually address this wage, we need to be thinking about it over time. And one last thing, because I'm out of time here, is we really urge them to, again, think about the roles that public contracts are paying in maintaining these wage inequalities. Public contracts with nonprofits pay for people to do caring work. Public contracts with construction firms pay for people to fill potholes and take down trees and things like that. As long as those public monies are flowing into a market economy that allows these inequalities to persist, we are reifying these structural inequalities. So I promised good news, and the good news was the 7% wage increase did come through, along with some other bumps for the childcare workforce in particular. So that was good news, so that was, the 3-point dunk. I think we're going to be scrambling and probably playing defense over the next few years. Seattle, like many West Coast cities, has taken a turn towards the center, away from the left of the political spectrum, and we have a more conservative city council who's now asking questions. But we actually just yesterday scheduled a meeting with the new chair of the Human Services Coalition to go over our study results and keep in this conversation. So I'll put our QR code up again, but it's great to have this conversation here.
Thank you. And then lastly, but certainly not least, we have Michelle Jackson. Michelle, I'll let you introduce yourself. I know that you'll be giving us an overview of Just Pay, so I'm excited to hear about that.
Great. Thank you. Thanks, everyone. Thanks for having me today. I'm Michelle Jackson. I'm the Executive Director of the Human Services Council, and we are a coalition of over 170 human service nonprofits in New York City, and we do city and state policy on behalf of the sector. And so what's nice is I'm picking up a very nice thread about the public contracts. So nice order, because that's really what our focus is. And I think my role here today is we're pissed off and we're not going to take it anymore, and you should too piece of this. We are not research, HSC is not a research, we're a little bit of a policy shop. We rely on the research of really smart people, and I see my role as like the pointy end of the spear of how do we take this amount of data and do something about it. So we created the Just Pay campaign, where we squarely put this problem that everyone else has illuminated really clearly onto government. The campaign tagline is to end the government exploitation of human services workers, to end poverty wages for human services workers in New York. We're very clear that government is the problem. As not a researcher, I just need enough data to be dangerous, and I'm glad that I can leave today with more data in our fight. In New York, these data points are not going to be a surprise for what we've heard today. Roughly 2/3 of all full-time human services workers had 2019 earnings below New York City's poverty threshold. Human services workers make about 30% less than if they did the same job in government, and about 1/4 of our workforce qualifies for SNAP benefits. So why this campaign now, which I'll give a little bit more detail about the campaign itself, is going into 2020, our members said wages and being able to retain qualified workers was the #1 issue. The pandemic just highlighted the real disparity between who frontline workers are, overwhelmingly women and people of color, and how much they're paid and how essential they are. New York was obviously uniquely hit by the pandemic, and these were people who risked and lost their lives in the pandemic to make sure that people had home delivered meals, that homeless shelters stayed open, that people who could not social distance had safe places to go. And it was those workers who did it. And there's some of the lowest paid workers in New York, only behind or ahead of restaurant workers. So it really illuminated the pandemic, the need for real structural change. And nonprofit executives really took that mantle in coming to HSC and our membership and creating the Just Pay campaign. So a campaign like this requires really important framing. I think when we put research into practice, we had to take some risks, which we certainly have, but government is the predominant funder of human services. When you think of like a minimum wage campaign, it can be easy to take like a McDonald's worker, they're the one I pick on all the time, and say, they're only making, $10 an hour, they're living in shelter, they're applying for benefits. But when I ask my members, can you get me a worker that you pay that is also in a homeless shelter, that's a really tough, how do we talk about nonprofit wage disparity and not villainize the nonprofits themselves? So really being very clear about the contractual elements, that government is the predominant funder, at least in New York, that's the same in many other localities, and that they're therefore the setter and payer of wages. Contracts last 7 to 10 years in New York with no cost escalators. So that means nonprofits are scrambling to pay the difference, and no single nonprofit can break this cycle. So if one nonprofit said, I'm not taking this contract, the city or the state is like, great, okay. And so all you do is lay off staff and remove a program from the community. But if you take these contracts, you're actually perpetuating a cycle of racial and gender disparity. And that's why I don't run a direct service nonprofit. I run this. So I get to just tell people that and try to solve the problem. So this campaign really needs to be a movement. The sector has to move together and say, we're not going to take it anymore. So you've seen this data in other places. New York City human services workers are overwhelmingly women and people of color. 57%, in fact, are women of color. The jobs vary greatly from social workers to maintenance workers and everything in between. And these are really good community jobs. I think that's another thing that we should highlight. These jobs are not going to be outsourced. They are not going anywhere. And as we have an aging population, which is the conversation happening in the next room, these jobs are going to be even more critical, not less. So that is why we created the Just Pay campaign. The idea is, just pay, as in just pay us, just pay us. And amongst friends, we add a, swear word in the middle of that, just something pay, during some of our darker moments. And we were able to really kind of put practice and policy together. We are asking for regular cost of living adjustments, COLAs at the city and state level on contracts, which is kind of the standard bearer of how you can put money into these contracts, while also really looking at things like prevailing wage and kind of mimicking. Some of our workforce is unionized, not all are, but can we mimic some of these like prevailing wage, true cost of living, wage floor type conversations to lift up wages? And we were able to, I think the policy achievements are important, but more importantly, as the campaign highlights, is like we engage workers. The nonprofit sector has a lot of resources that we don't capitalize on. New York State has over 800,000 human services workers. They are voters. Also, nonprofits are more likely to, when we register voters amongst workers and clients, they are more likely voters. So we do have a political perspective that needs to be heard. So we've done, in our first year, a bunch of rallies. Last year, we did a rally of over 6,000 people and completely shut down Broadway in front of City Hall. We didn't mean to do that, but oops. And then that didn't work. So we slept outside in the rain in June with a bunch of nonprofit executives to say, listen, I'm up all night. I'm tired of losing sleep over this. Thousands of emails sent, lots of social media, a lot of different kind of traditional advocacy actions. And we took like a more brazen tone. This year for Valentine's Day, we broke up with the mayor on social media. We were like, it's not us, it's you, and I think that, I like to have a little sense of humor in this work. I think it's really important. And it also like galvanized the population. And we were able to, this is more for people afterwards, and happy to share all this, like the kind of timeline of the campaign starting in late FY21 into 22, doing actions like sending emails, doing our rallies. We've done some short films and things like that. We were actually able to get in our first year at the state a 5.4% COLA, in our second year at the state a 4% COLA, some minor investments at the city, hence why I'm breaking up with the mayor this year, until, as we came through this last budget season at the city level, we were really disappointed. The city put in 60 million that grew to 150 million. 150 million split across 100,000 workers is nothing. And even our next victory, which I'll talk about, is still not enough. But, we were able to, through kind of perseverance and really staying the course, we were actually able to, our kind of recent announcement is we were able to get a 3-year COLA deal from New York City announced. I actually missed the prep call for this for this because we were making the announcement at City Hall. We were able to get a 3% for 3 years, so 3, 3, and 3, so a 9% cost of living adjustment for human services workers on top of what they call this like workforce enhancement pot, which is $150 million, all of that money baselined. It's a $1.4 billion investment in human services workers. Thank you. In New York City. And it's also not enough. And I think that's a really important thing, is like, that's a step. It's a really important win. And I think it hopefully leaves some people, as we go through some, scary numbers today, some like hope of when we organize, we win. Like when we fight as a sector, we can win. And we were really able to get these policy investments because the New York City human services sector operated differently than the nonprofit sector tends to operate across the country, including in New York. And trust me, there's some people who are still like, sleeping outside? We would never. We're like, okay, you send an email, we'll do this. And so, these victories, And we still have more to do. We have to fix some of the state COLAs. You won't be surprised to learn it doesn't always cover everyone. But this COLA victory at the city is really important. And so together, this campaign over the last 2 years has gotten over $2.5 billion in investments in human services wages from the city and state. And we have a lot left to do because it's not enough. Raising 9% wages when you're paid 30% less means not good enough. So this is a little, background on the victory we got just recently. It means I can do stuff like this instead of fighting at City Hall this year, but we will be back next year, really looking at kind of what our asks are next, because we need to pass prevailing wage. We need to get a wage floor. And I think it does boil down to a lot of the contracting processes that need to be fixed. So I too shared a URL code. Our website is justpayny.org where you can learn more. And happy to hear, I actually have a lot of new data for me to take back for our next fight as well. So thank you.
Thank you so much. Can we get a round of applause for our panelists? This is such a great panel. I've learned so much, and Ariane and I are working jointly on a project right now about the undervaluation of human services workers, as you all know. And so I've learned a lot, and I'm excited to learn more. So the first question I have actually is for Sarah, but anyone else can answer it as well. So as a researcher, I obviously love data. You mentioned that there's not enough of it. So my question for you is, well, first of all, it's twofold. So what are some maybe good data sources that you think exist right now that can kind of tell us more about this issue? And then following up to that, what are some better ways that we can get this data?
I've spent a lot of time thinking about this, and we get the question, what does the data say? But from both chambers of Congress, from our federal agencies, when we had the conversation with HRSA, they asked us to give them a national data source, and we didn't have one to give. That's just so discouraging, and I think it goes back to some of the roots of these issues that we've described this morning. One of the challenges with social work is that we are trained as generalists, but we're also specialized, and we work across so many different settings with different scope of practice, and we leave one setting and work in another, and that's actually a strength and not a weakness. So you have to study a workforce that is quite complex relative to maybe a counselor that is mostly working in an office. We are working in the community alongside our clients in many different roles. The Council on Social Work Education has received funding over the years, as has NASW, the National Association of Social Workers, to do some research, but neither of us have a robust workforce center. Some of our scholars, some at UNC, at Chapel Hill, have a center that's working on some of this, but it's not nearly enough. Social work, it will have an interstate compact soon. The legislation, the model bills are passing in states now. I think we're up to 5 or 6 states. When 7 or states pass that bill, a compact commission will be formed along with a national data set. A data will be housed about those licensed social workers. But it's only those folks that actually apply to participate in the compact that they'll have that information. So we need funders to be interested in the workforce and in the services that we provide and the good that we do. And we need all of you to help to spur that, to have an interest in studying the workforce, which is, in social work, just doesn't seem to be as much of a focus, or seems to be much more of a focus on how we can better support our clients. But I can assure you all that if we had this information, we could uplift the workforce, but also the clients.
Thank you. I don't know if anyone else wanted to add to that. Okay. All right. So one of the other things that you all, several of you actually kind of pointed to, is the underfunding of public contracts for care work and for human services work. So what are some ways to make inroads on the idea that public contracting for care work should be more equitable relative to public contracting for other kinds of work, such as capital project construction, healthcare, or IT? Anyone can answer that.
I can jump in. I spent a lot of time thinking about this. And I think to your point, I think some of it is about the economic engine of the kind of nonprofit, well, I say nonprofit sector because that's who my people are, but human services and like care work. And so I think having a better take, and I know Seattle has done some of that work, and we've been working with other localities who've done it, like nonprofit human services is an economic engine. And we don't blink twice about construction, tech, those types of contracts. I've never once gotten a question about like how much the head of IBM gets paid when they contract with the city to do work. And so I think from a kind of data perspective, appreciating the kind of economic engine that nonprofit human services jobs and work brings, because we're not just jobs, but we enable other people to go to work. Childcare and that allows people to go to work. Elder care, having a senior center where you just know your aging relative can, play around a mahjong and, have a hot meal is like it's a way that people can go to work. So the really economic opportunities of this work, I think, is important to demonstrating, like, then when you pay poverty wages, you're removing money from the economy. So there's a very clear economic argument that I think also needs to be made around some of this. And then, my default setting is always like fight harder. So what we're doing is organizing the human services sector to really say, like, I would love to just be like, it's the Just Say No campaign. Like, we're not taking these contracts anymore if you can continue to underpay them. And we've had some success in some of the smaller subsectors when certain contracts come out. So I think it is also about like local organizing around, this is a really terrible contract. And I'm like, why are you signing it? Stop signing, and trying to organize some people around that. Those pieces I think are important, in addition to some research on like how they're an economic engine in those communities.
I would also like to see more research on public health on the community level. A lot of the problems that social workers are addressing actually impose huge costs on communities, and yet there's not nearly enough research revealing the linkages. And I do think that's something that researchers could move forward with and make a real contribution.
Can I just say that having the opportunity to advocate alongside many different groups in DC, money is the problem with everything. And it's easy, I can't tell you how often I go into these spaces, and this is just one, and it feels like this is definitely the most important issue. And then you go to the next room and you're like, sheesh, this one is more important than that one. And this one is now, I don't know what we should do now. And I think that's the trouble that we're in. We need to have some solutions that don't just involve government funding, and yet this workforce is primarily reliant on that funding, which is limited, sometimes dwindling, and we are often the first to get cut.
Thank you. Okay. Yeah, so we do have time, thank you all, for one or two questions from the audience. So I saw one hand here. So yeah.
Hi, really appreciated the panel, fellow social worker here. And that loan thing was real. I had a big old party when my loans were paid off. I had to just, in thinking about, my work is in early care and education, and a lot of my research is in that space. And they're very, kind of these pathways and the issues that we struggle with the workforce are very similar to social work. One thing that I'm curious about, I don't know if anybody knows, is what we're looking like in terms of people entering the profession. Like in early care and education, the numbers are dwindling substantially. Is that the same in social work, or are people coming to the field?
Well, I welcome you to weigh in too, but I will say this, that social work programs have really increased over the last decade. There are many more now online programs. So I don't know, I mean, we understand that there's a need, but it does appear that there are continuing folks are motivated to come into the profession. Now, when we did a lot of the survey data to get the PSLF waiver implemented, and we work with many different partner organizations like the Student Bar Protection Center to do that, there were more than a few comments about leaving the profession because of the low pay and high student debt.
And this is one of those kind of research findings, but turns out people are more likely to think about leaving the profession if they're low paid once they're in it. Yeah, I mean, I think the workforce and kind of entry in and staying in the workforce happens on a lot of different levels. I'm in a school of social work. We pay attention to students coming in. We're at a demographic cliff right now where there are just fewer people entering college and, kind of the early post-college graduate programs than there were a decade ago. And that's demography. You can't argue with it. In a country with closed borders. But I think there's also growing awareness that I see among students that they don't want to commit to a job that's going to underpay them. And I think that is absolutely legitimate. I mean, there's been a strong movement within social work to be paid for your practicum hours, much like, craft workers. Part of the attraction to craft work, a white male-dominated field, is that you get paid as an apprentice. You get paid from day one while you're learning on the job because you're giving value on the job in terms of building your community. So I think that's I think in addition to the changes that are happening here, I think we need to figure out how to support and validate people coming into the profession who are saying, I don't want to work like that. I don't want to work in a nonprofit where I'm always burnt out and have substandard health care and things like that. And so I love the type of organizing you're talking about there, because it really does have to be a collective group. I think one other thing that's happening in social work is, at least in Washington State, we've seen a lot of people entering the field to become behavioral health providers, which is a huge need, but it's not the only thing happening in human services. And by entering something that's healthcare adjacent, people can make a living that's adjacent to healthcare, which is better wages. And so I think making sure that people doing frontline community organizing, elder care, youth care, food programming on the local level, that they're able to stay in that work and have a dignified and reasonable quality of life. Nobody enters this thinking they're going to get rich, but people would love to be stably housed and be able to take care of their kids' needs and their family's needs. So I think there's action to be paid attention to on a lot of levels.
Thank you. So we just have time for one more question, unfortunately. Does anyone else have a question? I saw.
Hi, Catherine Goldstein from Better Life Lab at New America. Dr. Fulbury mentioned decline in unionization, and I was curious if unions were playing a role in New York or in Seattle in these fights, and as care workers have made big advances in both of those areas through unionization.
Yeah, so we are lucky to have really good union partners in New York. There's a home care workers campaign right now at the state level, and the union that represents home care workers has been really integral into that perspective. And being part of that fight, like they're on the front lines, they're really up, like literally up there right now today in Albany, and then at the local level, DC 37 is the city's municipal union, and they also represent, they just took over the daycare contracts because they merged with a different union. And, unfortunately, my members are about a third unionized, a third partially unionized, a third no union involvement at all. And unionized workers don't make more than their non-unionized counterparts in New York, from what we found. Very anecdotal, again. Not a researcher, so this is not like I don't have a study to this. This is like a hands up, hands down kind of like scenario. And so unions haven't been able to crack the kind of triangular negotiations that happen. Like a union comes to a nonprofit leader and says, we want $2 million more in salaries. And the nonprofit leader is like, well, we're 90% government funded. So good luck. Let's do this together. But unions haven't always picked up the kind of thread of like, it's a negotiation between the union management and government. And so, but, DC 37 was crucial in our, COLA victory. We stood side by side with them at the press conference and things like that. So there's kind of like some of that is starting to happen and some of it isn't. But we have just found, unfortunately, the unionization, I think the sector should just unionize like itself. I represent management, so I can't say that out loud in New York. I can say it here. I've left the state lines, but that's just been, as it's all recorded, but I've said worse, I think that unionization has not necessarily helped. It doesn't mean that it wouldn't help, but it's, the kind of underpinnings have been a little back and forth in New York, at least.
Thank you, and thank you to, oh, did you? Okay. Thank you so much to our panelists. One more round of applause. I'm going to pass the mic over to our Chief Strategy Officer, Dr. Robin Watson-Ellerby.
Thank you, Jennifer. All righty, thank you. Thank you. Back over at the podium. So, can you guys hear me? Thank you. I told you I'm going to keep saying that. So, beyond emphasizing the undervaluation of care work and the challenges in earnings, I think, what this panel has done is also highlighted the need for data, for research, and as Nancy said, at all levels, for recommendations. And I think what's also highlighted is the need for collaboration from research think tanks, membership associations, universities, and so forth, who are all in this kind of good fight. And I'd be remiss if I didn't say the need for funding. I think that was important to highlight. And I think all of this collaboration and all of this data and research is needed so that we can have organizations like Michelle's, the Human Services Council, make the information actionable, even if it means breaking up with the mayor. So I want to say again, thank you to Jennifer, Ariane, Michelle, Nancy, Jenny, and Sarah. If you can give them another hand of applause. All righty, so we've had an excellent first half of this conference, and now it is time for lunch. So, so the lunch will be served in the reception hall, and again, this is a time to eat, to network, to also do these brief interviews if you're willing. I'm gonna keep lifting those up. I'm also gonna lift up wanting you to engage online with the hashtags IWPR Research, 1R at the beginning, and hashtag Care Conference. Following lunch at 1:45, we will have 2 more parallel sessions. The workshop 3, Care, Immigration, and Job Quality, is in the breakout room over there. And then back over here, we will have the care infrastructure, measuring gaps and identifying funding sources for closing them. All right. Well, in the meantime, have a good lunch, and I will see you back here at 1:45. Thank you. I know. Does it work?
Thank you.
Okay. Hello, welcome back from lunch. And thank you for coming to our workshop number 4, the Care Infrastructure, Measuring Gaps and Identifying Funding Sources. So before we start, I've been asked to read a couple of announcements. So please remember to share and tweet on social media using hashtags CareConference with 2 capital C's at IWPR eSearch, just 1 R in there, and at AU_PGAE, all caps. Also, when you get your chance to ask questions a little later, then please remember to use the microphone so people online can hear you, and also to give your name and your organization. Okay, so without further ado, so I should introduce myself. So I'm Mika Muirs. I'm professor of economics here at American University, and I'm the moderator for this session. And our first speaker will be Sanya Jalani, who will be presenting. She's a research consultant at IWPR, and she will be presenting slides, please. Whoops. Measuring the care infrastructure, a state-level indicator.
Thank you, Mika. My name is Sanya. As she mentioned, I am a 4th-year PhD student, as well as a research consultant for IWPR. So I'm going to be talking about a state-level indicator that Martha and I worked on as part of the Salesforce project for the Institute for Women's Policy Research. And in terms of the project objective and the motivation, the main point that we want to emphasize here is that we've developed a state-level indicator using both the demand for care and the supply of care work. So that in itself allows us to have an idea, as we'll see from the indicator, what is happening with respect to the paid supply side. And it wouldn't be fair if I didn't give credit to the sort of methodology that we're adapting. So Martha was part of a paper that was looking at the same idea in Colombia. And the methodology that we're focusing on is primarily borrowed from that original paper. So within that paper, the way that we define care infrastructure is essentially a relationship between the number of full-time care workers that are available and the people who need care. So it allows us to have a broader understanding of not just full-time workers for care work, but also those who are supplying at least some part of their work hours for care and what that would look like if it was translated into full-time equivalent. And before I go forward with the data sources, I kind of want to mention that this is our initial work for the US economy. And we're still teasing out a lot of different aspects, which I'll talk about later on, but just as a heads up. So for the US, we're looking at the American Community Survey, and we're looking at least 20 years in terms of data. So that gives us quite a rich understanding. And well, I didn't want it to be as rich as this slide, but we work with what we have here. So the way that we define or look at care infrastructure is by dividing it into care demand and care supply. So as the first thing I'll do here is kind of comment on how we're looking at care demand and supply. And then at the same time, I will also be addressing some potential questions or concerns that arise with trying to measure care infrastructure here. So in the first sense, when we look at care demand, we're looking at the potential demand. So in that context, we're including all individuals who may require assistance with their daily activities. So the reason I say that we're looking at this as potential demand, as opposed to the accurate or the overall accurate representation of demand, is because we break it down into 3 categories. First, we're looking at children aged under 18. Then we're looking at elderly individuals aged 65 and above. And thirdly, we're looking at a category for disabled people of all ages. Now, in the first 2 categories, we're not including disabled individuals. We only include those in the last category. So in our opening session, there was a mention of how not all disabled individuals would require care. Some are actually care providers. And we understand that with the type of categories we have, that we may have that kind of overlap. And we're still trying to figure out a better way of kind of arriving at these categories. So once we open up the room for discussion, if you have any comments on that, we'd be happy to take those. So because we have these three categories for care demand, we then have a corresponding category for care supply for each of those. Now, this is where it gets even trickier. Within care supply, we're essentially referring to occupations within the American Community Survey. And the way that those occupations are defined are in broader sense. For example, we have registered nurses, we have therapists, we have special education teachers. What we cannot derive from these occupations at this point is, are they providing this service for a particular age group, for a particular category, or is this just broader? So the way that it appears in the ACS for now is that it's a broad category talking about all registered nurses, not specializing in terms of are they looking at children or so on and so forth. So in that sense, we do have quite a bit of overlap when we try to arrive at child care supply, elderly care supply, and for disabled individuals supply. So like I said, there's a lot of things that needs to be teased out with measuring care. And there's a lot of research talking about how difficult it is. This just reiterates that point. So at some point, this will work, yes. So in terms of how are we looking at this then, we're basically creating an indicator where we're looking at all the full-time equivalent workers in each of these categories that we've talked about. And the way that we interpret this indicator is that it's essentially showing you X number of full-time equivalent care workers available per 100 people who require care. So this is for each category. So we have three indicators, one for childcare, one for elderly, and one for disabled. So this just allows an insight into the range of full-time equivalent workers that we have. So the results that I'm showing you here are from the year 2022. So it's the most recent data. So let's just talk about that a little bit. So we start off with childcare, and we see that the lower bound range is roughly about 2.7 full-time equivalent childcare worker available per 100 children who would require care. And we find that to be in the state of Utah, and the upper bound goes to around 15.4 full-time equivalent care workers, which is in DC. Similarly, for elderly care, we notice that there are 3 full-time equivalent care workers, which is the lowest bound, and the upper bound increases to 23 full-time equivalent care workers, and we go from Delaware to DC in terms of low to high. For disabled care, we have roughly 7 full-time equivalent care workers to about 22 full-time equivalent care workers. So all other states are lying in between these ranges. So what I can mention here is that there are very few states that tend to be in the higher bounds, and quite a few of them that are in the lower to low middle bound. So I'm just going to summarize all of this really quickly by reiterating the importance of this project, which is that what we've just shown here is a state-by-state indicator of how many full-time equivalent care workers do we have for each 100 worker, or for each 100 individual that requires care. And it is absolutely essential to have this stepping stone to arrive at a better understanding of what is happening within each state with respect to their demographic composition, which is something that is planned out for the future, and also to address the autonomy that states have with respect to policy implications and devising policy measures when it comes to paid sick leave and other avenues that could help facilitate the provision of care. So in that context, I call this as a baby step towards a broader picture of getting to as accurate a measure of the care deficit that we can, because measuring care is complicated. So for future extensions, one thing that IWPR will try to focus on is trying to rethink or reimagine these categories. And I think at this point, that is one of the most pivotal things to do. Also, try to evaluate what is a good benchmark. So while we're saying 2.7 individuals, is that enough, or do we actually need 15 or more workers? So those are quite a lot of things to do, and we'll see how it goes from there. Thank you.
So we have Sonia's co-author in the audience today. Martha, I just wanted to ask if you wanted to add anything before we move to some questions. Come up, or you could have.
Hi, everyone, and thank you, Sania, for a wonderful presentation. Just a couple of points regarding the extensions or the context also of the indicator. It's an approach and an initial step, as Sania said, to kind of like measuring this demand-supply relationship. But an important thing that we want to pay attention to is how does this impact the unpaid care and the people who provide this unpaid care, right? And that will be we would need an initial benchmark to understand what is a good level of full-time equivalent worker, but then the most important benchmark is how that impacts unpaid care. And therefore relating it to, well, if we want to have a better infrastructure and if this full-time equivalent worker increases, does it decrease unpaid care and therefore release women or those unpaid care workers from the burden of this unpaid care? And that's the end goal that we have, right? How do we take that further step, and how do we engage that conversation, or how do we kind of combine that analysis to the broader care economy and the broader care conversation that we're also thinking of right now and today here. So that's.
Thank you. Thank you, Martha. Okay, we have a few minutes if there are some questions or comments specifically on this presentation.
Hi, I'm Selin Seçilakın from American University. This is a very short question. Do you have any information on public investment in care infrastructure? Because I think that might also be relevant and be a possible extension.
So thank you for your question. At this point, we do not, but I do acknowledge the fact that it is an important thing to consider. And there was some discussion earlier over breakfast that maybe it might be a good idea to look at public and private expenditure. So we'll keep note of that. Thank you.
Hi, Krishana Lloyd, Child Trends. One thing I just would suggest is maybe there's some research by Bipartisan Policy Center on childcare specifically, but also choice and thinking about parental choice, which might be important to consider too, right? And sometimes, and I think what they struggle with is, are people really making choices, or is it a false choice? Like, are they backed into certain decisions that they need to make around childcare, or what the need is, or what have you? So anyway, just a suggestion that maybe thinking about that parental aspect and, what preferences are might be important too.
Thank you so much for that.
Hi, very interesting. I'm Laura from the Century Foundation. And sorry if I missed this, but I was just wondering if you have any sense of an adequacy benchmark of what level of supply would meet the demand for care that you discuss.
So as part of our extension, that's one thing that we will be aiming to look into, especially because the way that we're looking at supply and demand is each individual category. So that comes with a different context for each of those categories. You may need, say, 5 or 10 people to look after someone who's elderly, or you might need 2 or 3 to look after children. So each category would have a different composition. So that's the future extension project.
Thank you. Anyone else? Yes.
Hi, this is Ingrid from IDV, and I was wondering if maybe you have thought on also considering the aspect of how it will be, what will be the role of physical infrastructure, and the fact that maybe like the gap could be diminished by also increasing the physical infrastructure of more schools and more places to offer care.
Yes, so absolutely. Not only does care work depend on the human side of it, there's also the need to provide physical infrastructure. One small example I could provide is a project that I was working on in Colorado, where they were looking at what is a way of increasing community support. And one of the suggestions that was put forward was to provide a community center, because there are certain ethnic and racial groups there that needed time but couldn't because they were involved in unpaid childcare. So and they couldn't outsource that, or they couldn't address that unpaid care work because there was no physical infrastructure for care work. So the idea was to allow funds to be utilized for developing a community center, which would not only provide child care support, but also provide language classes or skills training for those women who were looking after their children. So even if they wanted to invest time in childcare, they would at least be getting some benefit out of that. So physical infrastructure definitely plays a big part in how the care supply and demand phase out.
One more? Is there anybody who hasn't spoken before? Take a second question? No? Okay, go ahead.
So my other thought was just around, there's some work that really looks, again, this is more focused on childcare, and I'm imagining this might be the same for elderly care, and I know it's the same for disabled care based on my own circumstances, but people use a mix of options, right, for childcare, and particularly for childcare, right, when we know the hours don't necessarily line up with work and what people actually need. So I'm just wondering if that's, if you considered that in that equation.
Well, at this point, we were just looking at the broader sort of, these are the total number of children, and these are, say, special education instructors or primary teachers or healthcare providers. But in terms of trying to get down into that classification, at least with the data set that we're looking at right now, that doesn't seem to be a possibility. So one other thing to consider would be, are there other sources or other data sources that we could refer to besides the American Community Survey? So this kind of, at this point, just presents like a bird's overview of what's happening with respect to care supply and care demand. But again, if we want to get into the more finer measurements of it, we kind of need to tease out measuring care economy or care infrastructure as a broad category. So.
Great, thank you. Okay, let's move on to our second speaker. Get the slides. So our second speaker will be Sarah Nolan from SEIU. This slide is, go back. There we go. Talking about better jobs, better care, building a home care infrastructure. Yeah, washed out, but.
Hi, everyone. Is this working? So I'm Sarah Nolan. I'm from SEIU, the Service Employees International Union. I lead our healthcare work there. And for those of you who don't know, SEIU represents a significant amount of care workers, about 800,000 home care workers, close to 200,000 nursing home workers, and about 100,000 childcare workers. It's care work is at least half of our membership, and so we care a lot about the care infrastructure. And I'm not an academic, or I was in another life, but I'm not an economist. I'm actually going to talk about the efforts we've made recently with the Biden administration to address what I would say is strengthening and filling some of the gaps in the care infrastructure. It's going to be more of a practical presentation. But first, I want to define the sort of care infrastructure broadly. So in one sense, care infrastructure is the workers that create the infrastructure for providing care. But I think there's a broader sense of infrastructure that includes not just the workers themselves, but also structures and processes that support both the workers and the consumers who need care, and the workers. We often say there's, the idea that there's a workforce shortage is from the perspective of employers, from the perspective of workers, and the perspective of our members. There's a shortage of good jobs. And so what are the structures you put in place to create, to make those jobs good jobs? And I would say infrastructure in that broad sense has three components. It's a system for financing care. So we'll often you heard a lot in recent years about the waiting lists for community-based home care. But those waiting lists are really a function of state Medicaid budgets. They're not primarily a matter of workforce. It's true, if there was money, there might not be enough workers, but the waiting lists are themselves a function of state budget choices. We basically have a very fragmented system in this country for financing, or sort of non-system for financing care. The second element is a structure to support workers by ensuring they can earn a living wage, but not only that, by also offering them a chance to get training, to advance professionally. These are all things we know help with retention and recruitment of workers. But I would also say not only wages, but offering ways to offer benefits. We think the best way to do this is through a union, but it is tremendously challenging to organize this workforce, which is highly disaggregated. And then the third element is we need an infrastructure to help support families who are looking for care. I think anybody who's tried to find care for a parent, especially, knows what a crazy system it is. This is actually, these three elements, the type of infrastructure that President Biden proposed back when he was still a candidate. And I think he's probably the first presidential candidate that actually used care and infrastructure in the same sentence, and defined it kind of in this broad way. This really sort of created, so it was a lot of money to expand eligibility for paid care through Medicaid programs. It was not very well defined, but structures. The idea was increasing pay and benefits for workers and enabling them to join unions, and also creating systems to link workers and consumers. That sort of provided a blueprint, which we saw kind of fleshed out in Build Back Better, which is a sad story that I will not go into, but I think probably people are aware it didn't quite get over the finish line. But one thing that did get over the finish line was the American Rescue Plan, which was legislation that was passed to address COVID. But it created an option, this was really significant, for states to get a 10 percentage point increase in federal Medicaid reimbursement, as long as they use the funds to, quote, enhance, expand, or strengthen HCBS. And states could use the dollars for traditional infrastructure, for assistive technology, for IT, for a whole bunch of things. But what is really telling is that, first of all, this was a whole bunch of money. It was $37 billion. And at least 2/3, probably a little more of states used it for workforce supports. They used it for bonus payments. They used it for incentive payments. They used it to create training programs. They used it to do a whole bunch of stuff to support the workforce. The other thing that's kind of notable is it was optional, and every single state in the country took it, including the reddest states, which I think is just sort of tellingly shows what the crying need to support the workforce. So that was followed by an executive order that President Biden issued almost exactly a year ago. That it included many directives on care. I'm going to mention two. The first directed CMS to improve access to home and community-based services, specifically by taking steps to support provider participation, which meant worker participation. And the word access is very key here because the Centers for Medicaid and Medicare Services, CMS, at that point had rulemaking underway to strengthen regulations that that basically implement the Medicaid access rule, Medicaid access requirements. This is like a very key Medicaid provision that says that payment rates have to be set at a level to ensure that Medicaid enrollees have the same access that other types of consumers do. And so we made the case to the administration that if you're looking at home care, first of all, there's no other comparable payer, really. Private pay is small. Medicare doesn't cover it. So that you really needed to create sort of a system for examining home care worker wages, home care worker working conditions, and require states to go through that process as a means of showing that they're in compliance with this very key Medicaid provision. So CMS put out a proposed rule last year, which we are expecting them to finalize any day, eagerly awaiting for it. And what's very cool about it is it requires, first of all, that states have to guarantee that the Medicaid payments that are going to home care, that a minimum percentage of them, which is right now set at 80%, are actually going to worker compensation. And really equally important from my perspective anyway, is that states would have to create an ongoing process to examine the adequacy of payments. That process would have to include workers, would also include consumers, and it would this group would on a regular basis advise and consult the state on what the right level of payments is to attract enough workers, because as we know, there are huge shortages. And then the second executive order provision that has also has led to actual action from CMS is basically the EO directed CMS to issue guidance creating incentives for states to better connect home care workers and consumers, and that's obviously one of the elements of Biden's original proposal. Last December, CMS put out guidance that says to states, you can create what they're calling a registry. And it's a registry in the sense that it's like a list of names that would allow like workers and consumers to connect, but it also could do a whole bunch of other things. It could provide training programs. It could provide, it could do some of like the data collection that would help you answer some of your questions. It could provide support to consumers who like are unfamiliar with the long-term care system. So a whole bunch of stuff. We're very hopeful about it. It's optional for states, but the sort of sweetener is that you get pretty much the federal government pretty much pays for all of the activities. So you have to have, the state has to like sort of initiate creating this option. but then the feds pay for most of it, which we hope will be an incentive for states. So that was like a super fast survey of all the like good things that have been happening. I would say these are all good first steps, but there's a lot more to do, and I'm not going to pretend that like this fills the huge gap that we have. And I would say that we can't build the infrastructure that we need, whether it is the infrastructure in the narrow sense of workers or in the broader sense that I just laid out. We can't build that without a big investment of public money. I would say another constraint is we choose to fund long-term care, both home-based care and institutional care, through the Medicaid system. And I don't think that's necessarily a problem, but that choice leads to a bunch of constraints given the nature, the state federal nature of Medicaid. So that leaves it, and that probably explains some of the variability we see, but that means the states have a tremendous amount of flexibility in how they address workforce problems, how they structure their care programs, whether it's Medicaid or child care or long-term care. And so I think if we really are going to think about filling in the gaps in infrastructure and building a real infrastructure, that is sort of a conversation ultimately about budgets and state budget choices and revenue raising choices. And that is sort of my segue into the next presentation. But happy to, that was a real fast overview, so happy to answer questions.
Great, thank you. Okay, so I should say, it's sort of obvious, but that Mike Darner is not here, so we do have a few extra minutes. So I think we could take maybe 3-4 minutes if there are questions or comments for Sarah. Okay, Ariane.
Hi, I'm Ariane Higovish from the Institute for Women's Policy Research. In a way, this takes up the speaker from the morning, Tiffany Boyman from the Women's Bureau, and they did a lot with federal money to try to incentivize states to innovate. And I'm just, Sarah, your talk is very cautious, right? It's optimistic, but also we know these states kind of. So are there some, how are they trying to make sure that states actually do the right things? Is it about learning, competition, not stopping them from opting out, whatever, all those things?
Is this on? Yeah. So how are they? If they is CMS, I don't think CMS actually really ever tries to do stuff. The way I see it, and this is, before I did sort of long-term care stuff, I wrote a lot of the Massachusetts law that was the basis for the ACA. And so my observation about Medicaid, and my presentation was really confined to Medicaid-funded home care because that's what our members provide, but also that's the biggest payer. I think when it comes to Medicaid, you have this copycat effect. You had that with states doing big waivers to cover more populations, to cover more kids in the 80s and 90s. And so I think I'm sort of hopeful there'll be a little bit of a copycat effect. And I that was part of my point about every state taking up the ARPA money. We haven't seen that in the Medicaid expansion space, right? And so there's that. But to give a little bit of credit to CMS, what they're doing is where they can actually require something is taking what they call a sort of best practices approach. And so the guidance I mentioned that they put out on registries is basically they say to states, you don't have to do this. You don't even have to do all the activities that we're laying out in this guidance, but here's what we think a good, robust registry would look like, and we're here to help you do that. And they've done a bunch of learning collaboratives lately with states
that I think promote the sort of cross, imitation, basically, I would call it.
Thank you. Okay, we can have one more and then we'll move on.
Julie Cashin with the Century Foundation. Hi, Sarah. Wanted to just follow up on that question because I think one of the things that is interesting about this is the way organizing may play a role in what Ariana is getting at. So I wondered if you could talk a little bit about how organizers could come together with policymakers or policy experts to move kind of states in the right direction or hold them accountable.
So I'll do that by way of one example, which is that's happening right now in Michigan. So Michigan is a place where home care workers used to be organized, and then there was a Republican governor, and that sort of all went away. And we're now reorganizing them and recreating a state authority that will act as the employer, which is one of the issues with home care workers. I mentioned it's hard to organize them because they're disaggregated, but in a lot of models, a lot of Medicaid models, and then obviously in the gray market, there's no one common employer to bargain with, right? So our solution in the past, when we've organized workers, has been to create an entity that acts as the employer of those workers in that state. So the great thing is Michigan is sort of creating this model, but they are specifically, and Governor Whitmer put in her budget, a registry with the and they were able to go sell it to the legislature by saying this isn't going to cost a lot of money because, like, here we have this guidance. So that's one example.
Thank you. Okay, let's move on to our last presentation. If we could get the slides, please. Okay, so we have John Witten from the Institute on Taxation and Economic Policy speaking to us about revenue to fund care, very important, infrastructure.
Thank you. Is that all right? Everybody can hear me okay? Great. It's nice to be here this afternoon. Like she just said, I'm John Whiten. I'm the Deputy Director at the Institute on Taxation and Economic Policy, and we focus only on tax policy. We don't really focus on the spending side of things. But we know, like a lot of you in this room, that spending on care and other public investments is critically important. And I want to talk a little bit about some of the ways we can do that at the federal level, the state level, and a little bit at the local level. Let's see. So this is us, like when we're in budget fights. Way too much. If you're in the back of the room or you're online, you might not even really be able to tell. We are fighting for that tiny slice of this tiny pie. And this is a terrible situation. I've lived through it. It ends up pitting advocates for one worthy cause against another. And it's a zero-sum kind of mentality that nobody, advocates for anything, you're not leaving this kind of thing satisfied. Nobody's happy. So really, we need a mindset shift. We need to grow this pie. That's a much more delicious looking pie, too, I think. We need to shift from this mindset of scarcity around finances to one of abundance. And that sounds great. It's great for like an activist or whatever. Obviously, this is politically super hard. But I think there's two things we have in our favor as we try to do this. One is that the people are largely with us. Polling for years and years shows kind of two distinct things. One, people like the public services they receive, and they don't want to lose them. And a lot of times they want new public services, right? And they're also incredibly supportive of new revenues, particularly new revenues on the wealthiest individuals and profitable corporations. And the second thing we have going in our favor is there's a lot of policy options to raise more revenue at all levels of government. And that's what I'm going to go a little more in depth about. I'm not going to go super wonky in depth because we don't have the time for that, but you can always find more stuff on our website for all the details. So I'm going to start at the federal level. And it's kind of a bad news, good news setup here. So at the federal level, really for the last many decades, it's been mostly a tax cutting kind of environment. And again, mostly centered on people at the top and profitable corporations. The corporate tax rate has been cut. The top income tax rate has been cut. The estate tax on inheritances has been sort of turned into a shell of its former self, and the federal government has lost a lot of revenue as a result. Everybody is so concerned about the deficit. We weren't really running these kind of deficits 20 years ago. We had enough revenue to do what we needed to do. And the tax cuts have really made it, constricted the entire environment. However, maybe there's good news. Okay. I thought my slide for good news had been taken out. I thought that was some sort of bad omen. The good news is there are things we can do, and right now I think politically the tide has been turning in recent years. The president we have today is probably the best president on tax fairness, at least since I've been alive. I'm 44, and possibly like in 2 lifetimes of mine. And he's not the only one. Other leading politicians are kind of putting tax fairness and the need to raise revenue and fund critical public investments at the center of their policy agenda, and they're talking about it all the time. So there's a lot of different kind of proposals that are out there at the federal level, from Congress, from the administration. I think really the best place to start is Biden's own budget. So he released his budget last month, and it is like it has for the past few years. It's like chock full of great revenue-raising options. I think all told, the revenue package in there would raise more than $5 trillion over 10 years. And there's big-ticket stuff. There's small item stuff in there. There's corporate. There's individual. There's taxing wealth. And it all is sort of centered at the top end of things. And it includes, plenty of things on the low income scale too, like low income credits and whatnot as well. So that's, I think, where we should be sort of focusing as advocates at the federal level, the stuff that is already out there, stuff the president is proposing, restoring the corporate tax rate, if not to what it was before President Trump, then close to it. Figuring out ways to better tax wealth. There's a lot of different proposals on unrealized capital gains that are out there, as well as sort of more fairly taxing realized capital gains, which are in most cases taxed less than regular wage income at the federal level. So that's a very top line look at the federal level. State level, there's three sort of contextual elements I want to touch on at the state level. The first is that, unlike the federal level, states have to balance their budgets, usually every year. And this creates, this constrains that pie. It makes the pie harder, but it also does come with some opportunities, particularly when there are economic downturns. Nobody wants to see an economic downturn, but when states start to run out of revenue, nobody wants to make program cuts, So those can be opportunities to actually flip things around and raise a fair amount of revenue going forward. The second piece of context is that since the 1990s, we've seen a number of waves of deep tax cuts at the state level. We are hopefully coming out of a wave of that from the last few years right now, which was unfortunately sort of spurred by the ARPA money and states deciding not to necessarily spend that on things like care infrastructure, but instead to spend it on tax cuts. But that is dwindling up, and I'm hoping that the tax cutting mania we've seen in the past few years at the state level will also subside. The last piece of context is less on the revenue and the pie and more on what it looks like inside that pie. And that's, the federal tax system is modestly progressive. So people who make the most pay the most. State tax systems are the opposite, total opposite. They're completely upside down and regressive in nearly every state. Our study, Who Pays, goes into super much detail on this. If you haven't ever seen it before, I encourage you to check it out at whopays.org. A couple of the top things from that report worth noting: 41 states tax the top 1% less than any other income group in that state. And in 44 states, the tax code actually exacerbates income inequality. So it takes income, the tax code then redistributes it, sorry, it's Friday, upward, right, in this sort of reverse Robin Hood effect. And all of this has an impact on revenue as well. So at the state level, the cop-out answer of what we can do to raise revenue is, depends on the state. But I could walk away after saying that, but that would be really unfair. There are a lot of proposals that we are advocating for in a range of states. I've kind of grouped them here into red state stuff, blue state stuff, but your mileage may vary. The most important thing in red states is preventing more cuts. Every time we see sort of a battle to protect an income tax or protect a corporate tax at the state level, when our allies and partners can win those fights, that's just as important as raising new revenue. It's protecting what we have and preventing things from getting worse, and it's just vitally important. It often gets overlooked in revenue conversations, so I just wanted to lift that up. But it doesn't have to be all defense all the time either in red states. One thing I want to highlight is there is, often a strong appetite around closing corporate tax loopholes for multi-state and multinational corporations. This can have broader bipartisan support at the state level because it often gets local business organizations and leaders to weigh in positively because they are leveling the tax playing field between them and sort of the big guys. Now on the blue state side, you'll see it kind of looks the same, right? You still have to prevent further cuts because we can't pretend like blue states don't love to cut taxes too. So you got to keep what you have, but then there's more options, and we're seeing a lot more sort of innovation in some of these states these days. Certainly, you can turn to higher top marginal rates on income. That's tried and true way to raise a lot of revenue. An increasing number of states are interested in taxing wealth, just like folks at the federal level are. This is kind of still a little bit uncharted territory, but there's a lot of interest from lawmakers in a good handful, about a dozen or less states. So I expect that this will be really an area where we see a lot of expansion in the coming years. And the last one that I'll mention is mansion taxes, which is really it's making the real estate transfer tax progressive. So in most places, well, there's 17 cities or counties that have these taxes, mansion tax, but in most places it's just a flat tax, which is regressive. Hi, come on in. So, the local mansion tax, basically, if you sell your house for over some set amount of money, you will pay a higher transfer tax rate than people who sell it at a lower rate. And again, like I said, that's mostly at the local level now, but I see that also kind of creeping into the state level conversations. I want to wrap up with just two state examples, and I'm going to need to really check my notes here because I will probably get things wrong. Like I said, we focus mostly on the tax side and not the spending side. So if I misstate anything about these two states, you can tell me. I want to start, though, with New Mexico. So for more than a decade, advocates there were trying to fix two big problems in New Mexico. First, the state just constantly had dismal rankings on every child well-being index. Big problem. Second, they had a regressive tax code that asked the most of those with the least and the least of those with the most. In 2019 and 2020, New Mexico made a lot of progress towards starting to fix some of those problems. They passed a big tax reform package that raised rates on high-income individuals, expanded low-income credits, and raised a whole lot of revenue in the process to fund critical priorities. And then they also created the Early Childhood Trust Fund in 2020. This was initially funded from general fund revenues, but the ongoing funding mechanism for that is from oil and gas extraction, which is a special dedicated fund in New Mexico and other kind of states with a lot of oil and gas extraction. 2 years later, in 2022, New Mexico sort of won again in this area by voters approved the dedicated permanent fund for childcare investments, right? And so this fund is expected to get a few $100 million a year, is my understanding, and that's going to fund a range of care investments, everything from pre-K access to reimbursement rates for providers. I was involved in New Mexico before the first tax reform package was passed, like pretty heavily with advocates there. And when I reconnected with one recently, as I was preparing for this, she really suggested that we have to think about all of that stuff holistically. Like the tax reform package might not seem super connected to the care fund, but it really created the comfort with having more general fund revenue created more comfort for lawmakers and the public to take more money from those special funds to then fund care. And also, like we go back to the pie, right? Having more general fund revenue means you can spend more money on good things. So that is what happened there as well. Moving across the country to Massachusetts, there it's a little less care specific, but I think it's an instructive tax story too. In 2022, after a long time coming, voters approved a surtax on income over $1 million. It's called the Fair Share Amendment. I'm sure Sarah is very familiar with this from her work in Massachusetts for a long time. The surtax was a way of getting around the fact that that state's income tax is flat. So we see a lot of flat income taxes in the states, and advocates have to figure out creative ways to raise more revenue from wealthy people if they can't make a graduated rate. This new tax has raised hundreds of millions of dollars already for transportation and education, which is what it's earmarked for. The education funding includes a whole lot of stuff for early ed and care. Couple examples that have come through recently that have already been funded is free school lunch for every K-12 student throughout the state, and then a big investment in a care fund, not a big investment, like $25 million, I think was the number, in a care fund that is going to increase reimbursement rates and reduce wait times for spots. Let's see. I have maybe a final thing. Yeah, that's all. Sorry, this was like super fast, covered a lot of ground, federal, state. I encourage you to check out all of the stuff on our website for more detailed information, like on the Biden budget or on state budgets or anything. And I'm happy to answer any questions now or later. Thanks.
Great. Thank you. Okay, so now we'd like to take 3 or 4 minutes for questions on John's presentation, and then we will open it up for general discussion and questions and comments. Yes.
Hi, thanks. That was really interesting. When people were talking about accounting earlier and all the money stuff, I've done budgeting and childcare, so it's very interesting to me. My name's Anya, and I wanted to ask what you think the viability is of really putting the estate tax policy ideas just towards care, like looking at it as just segmenting us out of everything else, maybe? I don't know. I'm just curious your just general thoughts on the viability, and if any of you never saw when Catherine Edwards, who's an economist, spoke to one of the senators about this idea. It was just a really powerful message just about the value of care, and so I'm just curious what your thoughts are.
Yeah, thank you. I think, it's a good idea. I mean, I am usually against sort of dedicated funding. I think it cuts both ways. Having dedicated revenue for a new, dedicated spending side things for a new piece of revenue, everybody wants that. Advocates for everything want that, which makes it hard to get in there if that's your spending priority. But it can help with popular opinion, and you see. Especially when revenue referendum go to the polls, when it's like a ballot measure, the things that win more often, and this is more at the state and local level, are things that are tied to specific investments. Because then people can really connect it in a way that they can't when they're just like, I don't know, where's this going to go? So I don't know. That's about all I can really say. It could be a viable option. I would expect it would be challenging to like really get the whole thing, but go for it.
Thanks. Another question or comment? In the back, maybe? Yeah.
So this might be a comment and question, but I think part of what's been really hard with Biden's budget is seeing the cuts on all things healthcare gradually each year after year, which loops directly into the conversation of care and its impact all around on specifically disproportionately impacted communities. So while there's solutions, and I see, your comment on him being one of the most progressive, at the same time, it's such a struggle to see those specific cuts at play gradually, especially when the recurrent issue is all things healthcare spending and non-defense spending in Congress.
Could you introduce yourself?
Hi, my name is Daniela Ochoa Diaz.
Yeah, I mean, you're not wrong, right? I mean, I definitely, again, I'm not as focused on the spending side of things and that side of the ledger. I do think, Biden has been very strong on taxes and on new revenue, but the federal budget process is not a pretty place to be, right? Yeah, it's a painful thing. And I think it can feel often like no matter what, we're losing. But I also, if that was the case, then why are we here? And, we might as well just go run and hide in the corner or something. So I do want to try to always think that we can at least improve, even if it ends up being sort of around the edges.
Response to that comment. I'm putting on my rose-colored glasses. One more for John before we move on to open discussion. Ariane, did you have a?
Thank you. It's Ariane Higovish again. Mine, maybe bridges two issues. So you said in Michigan, not in Michigan, in New Mexico and Massachusetts, both there was advocacy, which then led to change. And so what was the messaging that brought this about? And to link this also, Vicky Schauber is sitting behind me thinking about paid family leave, how coalitions were built. So what were the themes? What were the coalitions? What pushed it over the top?
I will let Sarah talk about the Massachusetts side on that, but certainly in New Mexico and what we've seen in other states is the revenue coalition. Every state has some sort of revenue coalition. It's usually headed by the fiscal shop that is the state level think tank. I used to work at one in New Jersey. You've got to broaden that group, right? You just got to keep broadening that group. You have to keep that group disciplined. If I'm just talking about tax right now, you have to keep that group disciplined on, we need more revenue basically for everything, right? And the care advocates at the table can then kind of take that message to their people and go back and say, we need this for care. The enviros can go and say, we need it for the environment. But when you're sitting at a table with a lawmaker all together, it's really powerful to see all of those people all saying we need more revenue. So I think that that's really been a big change at the state level in terms of the public message. I also think that just the acknowledgement of the fact that the tax code is so upside down. I'm not just trying to toot our own horn about this data on who pays and that, but we do hear from state advocates that is a real difference maker in a lot of the campaigns at the state level.
I can add in on the history of Massachusetts. And so actually I am a former academic and a classicist. And so I tend to look at the long durée of history. And the Massachusetts created a flat tax in the Constitution in the 1800s, and it has been on the ballot 4 times in the last 100 years and failed miserably the last time in 1994 when I worked on it, and I still have PTSD from it. And so the going to the sort of tax, which is not a graduated tax, it's just a tax on very high income, was a way to deal with the failure to ever, with the likelihood that they were never going to adopt what I would argue would be a much more fair tax system. But even, and again, speaking historically, the attempt, that sort of success in 22 was a long time coming. I mean, this very or similar proposal was sort of circulating 10 years ago when I was still doing state budget work in Massachusetts. And why transportation and education, I think those were clearly crying needs. Has to do with the way education is funded in Massachusetts. I would also say has to do, Medicaid's mandatory, right? And I mean, obviously states make choices about how much or little they do, but it tends to get funded and be a little less volatile. And I would also say Mike Dukakis loves transportation.
Okay, thank you. So now I'd like to open it up to general questions or comments for any of the speakers or on the topic more generally or widely. Yes.
Thank you. I'm Laura from the Century Foundation. So one of the things that you mentioned around building a bigger pie was wealth taxes. And as we know, there's a significant gender and racial wealth gap. And I was just hoping you could talk a little bit about how you see wealth taxes in relationship to like how they might impact gender and racial wealth gaps, especially considering that those gaps emerge in large part due to care responsibilities.
Yeah, I mean, it would help tremendously to close both. It's the amount of wealth in this country that flows to white men. I'm saying this as a white man. It's astounding, you know. And anything we can do to better tax those gains that just kind of can go on in perpetuity and oftentimes can be handed down from generation to generation without being taxed is going to certainly reduce the racial wealth gap, the gender wealth gap, and hopefully put people on a more solid footing moving forward.
Thank you. Heidi, you had a question.
I just wanted to say that I really appreciated this session because it has a very practical approach. I love the big picture sessions we also had. I love your presentation in particular. But it's nice to get, you know, something practical. So I like the fact when Sania, you said, well, you know, this is what the data set has. This is what we're going to use to make these indicators. Duh, yeah. That's what policy work is. You work with what you got. And Sarah, I feel like if you could turn those slides into a manual, into a guide of here's what you can do with Medicaid in all the different ways, that would just be fantastic. People would really love that. And then also, John, you know, your work on what we can do to increase taxes. And I forget what other points you made, but there's just so many policy options there. So I was just glad to see, you know, some focus on practical policy. So I just appreciate your panel. Thank you very much.
And things that can be done, right?
Yeah, yeah.
Yeah. Okay, another comment or question? Yes.
Hi, it's Ingrid again. Just a small comment, and is that the conversation focused on your presentation, John, about increasing tax, but I thought, how could it be the approach of also created incentives by reducing tax to like care providers, and also like to companies that offer benefits to care providers, like yes, in general, like creating incentives by to the private sector to also provide care.
Sorry, I was like having a choking fit while you were asking your question, which is what I get for trying to drink a little sip of water. Yeah, I think you can, I think we can make the tax code more fair on both ends, right? We can use it to raise revenue to fund things directly. We can also use it to incentivize positive social outcomes, right? I think a good example at the federal level is last year's or 2022's Inflation Reduction Act, right? It raised a bunch of revenue to fund things directly, but it also included a lot of tax credits, around environmental things and that nature. So I think that's a good model to use at the state level and even at the federal level for care.
Yeah, I would. I'm a grump about. I used to work on tax policy. I think we should just tax everybody and then use the money in a good way. I mean, I get that it makes it easier to pass, and I'm not totally against doing policy through the tax code. We do it. I don't think it's always wrong. I think when you do it, you have to think about how you structure it so that it's still progressive. So you could give families. I mean, I am not against the idea. For example, this is one proposal that's been out there of giving tax credits to family care providers, but I think you have to figure out how you do it in a way that's not actually rewarding sort of high income, high wealth families. And we can do it. We've done it with the child care tax credit, but I have to say that. So
I second that emotion, as they would say.
Hi, I'm Amy Matsui, Director of Income Security at the National Women's Law Center. And I just wanted to chime in on that because I couldn't stop myself. So I think one thing that we have seen from tax credits that are directed towards employers, both for childcare and for paid leave, is that for a variety of reasons, including that large corporations often don't have a lot of tax liability, there's kind of a limit to what you can incentivize in terms of behavior with tax credits. So are you rewarding kind of companies that are going to be doing this and can afford to do that for white collar employees anyway? Or are you actually kind of creating more supply that can be scaled up? And I think that the jury, the most generous description on the federal level is that the jury is out, but in fact, it's been really underclaimed. So in these two specific cases, at least tax credits for employers for childcare and for paid leave, they haven't really worked, but there's a continual allure to those. So I'll stop there.
Thank you.
Hi, Vicky Shabo from New America. Since I got invoked before and I wanted to piggyback on that, I was just going to say, I feel like I'm really glad to have a revenue conversation here because I feel like for so long, our substantive conversations about the kinds of policies that we want to pass have been devoid of conversations about revenue. I also feel like there's this constant tension about minimizing the cost, sort of talking about you can get a lot for a little, and sort of I feel like that undermines our ability to say, actually, we need big investments because we have big problems and there's a big unmet need. And so just thinking about how we lean into messaging about the fact that, for example, a comprehensive national paid leave program could cost $600 billion over 10 years. And that's okay, because we actually have more than 100 million people that don't have paid family leave in this country. Similarly for childcare and for the work that Julie and others have done here. And then the last thing that I was really struck by is sort of this description of groups sitting around revenue tables with different priorities, but talking to lawmakers about the need to raise revenue. And I feel like that is super, super important and hasn't been done that much, but also isn't enough. And that comes down to political power. And once you have agreement that you need to raise revenue, how that revenue gets allocated. And I think we saw the limits in Build Back Better of sort of where the money went and where it didn't go. And then the last connection I'll make is to the wage gap point, which is part of the problem with women and women of color earning less is it diminishes their political power because we have such a rigged system in terms of financing. So I feel like all of these things fit together in really troubling ways, and I just kind of wanted to name all those things, but also particularly for folks who've been active at the state level, sort of how have you seen that play out and seen care win? And I think we've heard some of that, but if there's just anything else to say.
I don't have an answer to that last question, but I will say on your point about sort of limits of like everyone sitting around the table and pushing for something, you're totally right. I mean, that group has to stay together all the whole time, right? Like you can't just come together. It has to be a permanent sort of piece of the progressive infrastructure in a state or whatever, because there has to be accountability. And that's one of the most important pieces of tax campaign work, certainly at the state level, which I'm more familiar with, because it might not match up to the spending they said they were going to do, and often they just turn around and will do the opposite thing and then go and cut taxes, a year later if it becomes an election year or whatever. So I think I'm glad you raised that point, and I just wanted to echo that.
I'll just add to that. I mean, I don't have a perfect answer either, but I mean, and I'm going to unsurprisingly invoke unions again, but where we have organized home care workers in Washington, in California, in Oregon, in Illinois, in Massachusetts, I think you can point to substantial progress on and the very fact of the organizing and of the existence of a union gives those workers who I agree are disenfranchised politically a chance to come together. I mean, frankly, during the ACA battle, some of the best lobbying was done by our home care members, right? And so in many of those states where we have organized home care workers and created this authority-like structure, there has not only been an increase in access to training, but there's been a force to fight for increases in state funding. So I don't tell my bosses there's probably other ways to do it, but a union is a very good way to do it.
So I kind of wanted to add just one point from this morning, coming back to this point about accounting. I feel like, so when we're sitting at the table and talking about revenue and how much revenue we need and how this is really expensive, but we need the revenue, the talking about the invisibilized, externalized costs, right, that we talked about this morning, they get pushed off onto into unpaid care, by women where it's invisible. The more we can make those costs visible, the better positioned we are to make this argument about these revenues, right? That these costs aren't new. We're not suddenly creating them, right? We're talking about addressing them in a more humane and actually productive and so on way, right? So I think that those two parts kind of go together.
And I just wanted to add one more bit on the same idea, right? It does us no service as advocates to try to undercut what something costs, because we're not going to get what we're asking for, like, ever. So it should be the big number. We shouldn't be like, oh, we can really fudge this and we'll only ask for $400 million. If you need $1 billion, you need $1 billion, and ask for it. You're probably not going to get it. So we don't want to end up in a place where we're getting 200 million because we asked for 400 million. We'd much rather be getting 600 million out of the billion we asked for.
Right. Well, while we're arguing that it's actually worth 1.5 million, right? So, or whatever it was, how many zeros you had, I don't remember, but okay. I think we're out of time. So thank you so much.
Just add one thing, because I want to bring it back to Sonia's. I was totally psyched by her presentation. I think it needs to be data driven, and that's why I'm so excited about what you put out. Because I'll say throughout Build Back Better, I was constantly getting how many jobs is this going to create? How many people is it going to serve? And I made it up all the time, and it was intellectually honest making it up, but you do have to start from somewhere. And I think the fact that we don't have some of this data just shows how this work has been so much in the shadows. And so I think I'm super excited by what you're doing, and just wanted to bring it back to the beginning.
Thank you, Sarah. Great. Okay, so the closing plenary will be in this room. So I'm going to welcome you back here at some time, which maybe I should mention. So at 3:20. Thank you.
So how has everyone been enjoying the day so far? Great. I've been hearing a lot of good things, and so glad to hear that you all are enjoying yourselves and finding the content for the day useful. So I'm delighted to introduce our final plenary for the day. This plenary is going to be focused on crafting solutions, unblocking progress toward gender and racial economic equity. And I have the honor of introducing my friend, Julie Cashin, who's moderating this panel. Julie is a senior fellow and the director for Women's Economic Justice at the Century Foundation. With expertise in work and family, caregiving, economic mobility, and labor. Julie has more than 2 decades of experience forwarding these issues in federal and state government and through the nonprofit sector, including helping to draft 3 major pieces of national legislation. As a labor policy advisor to the late Senator Edward M. Kennedy, she helped draft and build momentum for the first paid sick days bill in Congress, the Healthy Families Act. As policy director of the 3-year Make It Work campaign, she drafted a visionary child care proposal whose principles were incorporated into the Child Care and Working Families Act. And as a senior advisor to the National Domestic Workers Alliance, she led the work to create and introduce the first ever National Domestic Workers Bill of Rights. Yes. Julie has an extensive resume in this space, as well as, just a record of being such a passionate advocate for economic justice and women's issues. So Julie, over to you.
Thank you. It's so great to be here, and I'm going to take moderator's privilege to just ask for another round of applause for Dr. Jamila Taylor, because I think all of us in the community who know her are just so thrilled to have her leadership at the Institute for Women's Policy Research. It could not be a better fit. So we're thrilled. And I'm so happy to be helping to close out the day here. So we started our day talking about the intersections of care, gender, and racial inequality. We heard from experts in workshops about challenges of an aging population, retirement gaps in elder care, the undervaluation of care work in the human services sector, care, immigration, and job quality, or measuring gaps and identifying funding sources. And we weren't all able to go to all of those. And so I asked my colleagues to capture some of the highlights just to give you real quick. So thank you, Leah and Laura. So one thing that folks may have missed or got to hear is Nancy Fulbright talking about is care undervalued because it's provided by disempowered groups, or are disempowered groups relegated to care work because it's undervalued? It's not mutually exclusive, but it's a really important question. So I had missed that, and I was thrilled that we got that captured. Also, Ariane was talking about how the undervaluation of women's work is recognized as pay discrimination in almost every other country. Dr. Jenny Romich talked about how wage gaps are not because jobs require less skill. They're in spite of the fact that they are incredibly skilled jobs. So some of the highlights of things that some of us may not have gotten to hear in some of the breakout groups. But now we're going to talk about crafting solutions, unblocking progress toward gender and racial economic equity. And we have this amazing group of experts that we're going to talk to today. Young Yoon was going to be here with us from the National Domestic Workers Alliance. Unfortunately, she wasn't able to be. So the hope was that we'd be able to have a rich discussion, including immigration, which is her expertise. We will not be able to do that without her here, but we will think about those themes as well. And when I think about unlocking progress, I think about what that means, right? So in my spare time, when I'm not policy wonking, I'm a certified life coach. And I work with people to support them to get from where they are to where they want to be. And that work starts with dreaming big about where they want to be. And then thinking about what's the gap between where they are today and what that vision is, and creating a journey, a map, a how to get from one place to the next. So as you think about today, we started with a shared analysis of the problem, so we really understand where we're coming from. And now this is the time when we get to think about what could the future look like? How do we imagine and dream and vision what we're working toward and why we need to get there and what we need to do to get there too. So let's get on with it. Let's hear about these dreams. Let's hear about where we are now and what's in between our dreams and our current reality. And we'll start with Professor Derek Hamilton. He's a university professor, the Henry Cohen Professor of Economics and Urban Policy, and founding director of the Institute on Race, Power, and Political Economy at the New School. His resume is much longer than that. I encourage you to read it, but I'm going to let you hear from him now.
Thank you, Julie. I can talk loud. I'm not sure if this is on. But oh, Trey. So quick shout out to Jamila Taylor for leading. Oh yeah, we'll clap again. Yeah. The part on my resume that you didn't include that I'm extremely proud of is I'm on the board of the Institute for Women's Policy Research, and very grateful for everybody in that organization and the work that has been done and will be done. I don't believe there's a more, well, I guess there are people in this room, I gotta be careful. It is one of the leading organizations in collaboration that will, all right. So let me get into this, all right. Right, so our task at hand. I wrote a paper with Cassie Robertson in which we made the point that industrial policy should not be separable from labor policy. They should be one and the same. It's a problem that we separate them. It is also the case that industrial policy, the best form that has happened throughout time and history, has been those that have centered people and the environments in which they live. And that's a conception of a care economy. So in determining how to define, structure, and direct public resources with the purpose of promoting economic health and industrial activity, here's another point that we don't do in economics. We should first and foremost begin with a simple but fundamental question: what is the purpose of an economy? And then what is government's role in achieving that purpose? I think if we ask that question, we might come up with something different than what we have. It's naive also to not recognize that every policy structure in the US, it's grounded in race, it's grounded in gender and social stratification more broadly. And the impact of these stratifications are certainly not exclusive to Black people and women. So you're going to hear me in this framing make the point that identity group stratification, politics, and economics are not separable. It's not novel that economics and politics are related, or that gender and economics are related, but it's the intersection of all three. Throughout human history, race, gender, and social identity more broadly has had a profound role in shaping outcomes. The paradox in empirical reality is that race and gender-based disparities persist and even widen with higher socioeconomic status. The empirical reality is vivid when it comes to wealth, but it's not limited to wealth. Education as an explanatory power and human capital go well beyond wealth and their limitations in understanding stratification. Moreover, if we look across business cycles, these disparities widen with higher levels of education and across business cycle, further emphasizing the role of social identity hierarchy in establishing the sorting mechanisms, and it gets magnified through recessions. Let me get to solutions. I see I don't want to ramble on. You've all heard all the problems and know the problems, but from the beginning, the American project, our government has proactively shaped our economy in determining who reaps benefits from prosperity. The proactive role of government in determining winners and losers, especially by race and gender, should be undeniable. There's no aspect of our economy that's beyond its purview of the continuous involvement of government. But all is not lost for us. The good news is that our power is in collective agency. Our agency lies not in the mythic notion of pull yourself up, self-help, or individualized solutions, but in political power. Ultimately, in asking that question about the economy, our economy is a choice variable. We get to determine and define value. All markets, all economic relationships are political choices enforced by our government through both the discourse, our laws, as well as the policies. Exerting a claim on our economy requires building movements and organizations that can exact demands and conditions that affirmatively and inclusively empower all people with the resources to be self-determining and have economic agency. So going back to that fundamental question of what is the purpose of an economy and what is government's role, I believe the purpose of an economy should be to promote our productive capacities in righteous ways, to advance tranquility and human flourishing, to enable people to be self-determining in righteous ways. And we have a pathway to achieve it. Although not complete or perfect, when Eleanor Roosevelt 75 years ago in the International Coalition issued the United Nations Landmark Declaration of Human Rights, it presented a blueprint. In isolation, those rights or subsets of those human rights are inadequate and in fact are a co-optation of a notion of rights and freedom. A right to assembly, speech, choice. It's limited if an individual lacks basic needs like a job, adequate income, shelter, food, or health care. Over time, economic rights are the one category that seem to have lost momentum in that human rights paradigm. But the Marshall Plan and policies in the New Deal and Great Society, and we know they were inadequate and excluded lots of women and lots of Black people and lots of people from the global South. But they demonstrate what realizing the ambitions set out in the Declaration would look like, especially as they relate to making investments in people in place. We need industrial policy to center people in the environment, not in a charitable sense, but in a productive sense, enabling them with the resources to contribute in dynamic ways to the economy. It is the best foreign as well as domestic policy, especially if we want to value and promote tranquility. I feel like my time is limiting, so I'm gonna try to get to a conclusion real quick. An inclusive economic frame turns the notion of our political economy that naturalizes poverty and inequality as the result of unproductive and deficient behavior, it turns it on its head. That is, poverty and inequality become the result of policy choices that deny people the resources they need to live meaningful lives. There's a baseline set of enabling goods and services that are critical for individuals to have self-determination, without which they are incapable of reaping economic returns for their efforts or their ingenuity. Governments need to directly compete with and crowd out inferior private options that do not ensure universal and quality health care, housing, schooling, financial services, capital, and free mobility without the psychological and physical threat of detention or bodily harm at the hands of a state-sanctioned violence, the capacity to reproduce and choose your family without the state-sanctioned violence or reductions because your identity is linked to a stigmatized group. In the end, our economic system and industrial policy needs to promote that economy that centers people. These investments need to be made permanently and intentionally inclusive of gender, race, ethnicity, and social identity in general by design, implementation, and management. Otherwise, we will falter in achieving a free, just society.
Thank you so much. No problem. I'm going to ask a few follow-up questions before we move on to Charity, but maybe Charity, if you want to switch mics, if this one's not working, or if someone could help us with the mic. Thank you. So a follow-up, I mean, what a great framework for us to be thinking about all of this within. And I know some of the specific policies that you talk about and have thought about are basic income guarantees and baby bonds. And that, you know, we are talking today a lot about childcare and paid leave, paid sick days, home and community-based services, role of domestic workers and direct care workers. Would love to hear about how these policies fit into the framework that you're putting out there.
I mean, essentially, unless we're recording, I can be loud as well. Right, so we are getting a lot of attention in ways that we haven't in the past with some of these bolder ideas from the last 50 years, but they're not that new, right? I was trying to point to, there's been points in time and history in which we've done them in inadequate ways. Some things that we need to be careful from is pushing forward issues without a North Star conception of justice and freedom. So baby bonds need not compete with access to reproductive rights, both in terms of being able to terminate a pregnancy, as well as being able to have access to the resources to procreate and choose love. It need not compete with guaranteed income. And the way for them not to compete with this is to have a conception of a North Star, of economic rights. And that, I think, is part of the point. And then how have we been able to get to this point? Social movements, right? The Biden administration has done a whole lot of unprecedented things, but also people have made them do those unprecedented things, right? Compare and contrast how we handled the pandemic versus the Great Recession. So these things that people would have thought of as pie in the sky, and there was a lot of suffering and vulnerability during the pandemic. But could you have imagined that the federal government, through the IRS, of all means, sent trillions of dollars in the form of direct cash to the American people? And if not for a couple of senators, we might have had a refundable child tax credit. This is antithetical to the thinkings that we've had in the last 50 years, that if you gave poor people money, you would incentivize irresponsible behavior, and they would be getting these resources in an unfair way. So conception very well may be changing. We now may be, and there are lots of reasons as to why, and lots of overtones as to why. It took a pandemic where, you know, we dealt with this crisis where we were willing to do some of these things. It took George Floyd on TV, where we had people across the nation shouting in unison that Black Lives Matter. So, you know, at the risk of going on and on and on, I think we have to always be ready with the policies and the commitment to what we think and know is right. I think that the solutions are not that deep. Baby bonds as a policy is grounded in the simple fact that how is wealth generated? It is wealth that begets more wealth. So baby bonds is designed to provide people with the necessary resource to achieve wealth. Capital at a key point in their life. You know, somebody asked me the question once before about guaranteed income. What, are you just going to give poor people money? The answer is yes. And why are you going to give them money? Because they're poor, because they don't have enough, right? But it is essentially thinking about these things not as charity, but resources to facilitate people to be their best selves. We always think about lines on a ledger in government that go to firms as investments, but lines on a ledger that go to people as costs. Flip that, invest in people, and it will benefit us all.
Thank you. Amazing. All right, I can't wait to get back to you, but I'm gonna move on. Speaking of collective agency, Charity Wilson is a legislative representative in the advocacy hub of the AFL-CIO, where she works on the women's economic agenda, criminal justice reform, federal workers issues, and unemployment compensation. Charity is also an amazing person to work with, and I am so thrilled that I get to work with her. And I want to talk to you. You think a lot about the union advantage, the role of collective bargaining and organizing, and especially in the context of care and care policy. Would love to start with your own story about why a union matters so much to individuals, to families' lives, and to care.
Thank you so much. And I can say the same to Julie. Julie is a leader among those working on care issues across the country. And anything that she's a part of, I want to associate myself with because it's going to be very good. I have a family history with unions. My grandfather in the 30s in Alabama helped start a union at the mine where he worked. He was a coal miner, TCI. I found out in doing a little bit of research that not only did he help start that union, he also was part of a case before the Supreme Court where defining work under the federal labor standards as part of the National Labor Relations Act. I did not know that until 2 days ago. I saw Muskota local, and I said that was his local. And even though he did die of lung cancer, he had a pension, which in rural Alabama, to work your whole life and to have a pension was relatively unheard of. My father was a Teamster. When he retired from the Army, he went to work at General Electric. He became a Teamster. And he was, through his union, he was able to buy a home, send 3 children to college, and again, retire with a comfortable pension. Now, this is where I come into that story. As a young child, I was diagnosed with what they then called juvenile diabetes. It's now known as type 1 diabetes. As a very young child. Because my father had health insurance and I was his dependent, I was able to obtain the insulin and supplies that I needed to literally keep me alive. I was able to obtain the newest technology, whether it was a glucometer, an insulin pump, or continuous glucose monitor, far before most other diabetics could. And then as an adult, I've been a union member most of my adult life, and I'm currently a member of the Newspaper Guild, CWA. I can literally say that being in a union family not only improved my life, it literally saved my life. And one thing that my father always would point out to me was that I had the union advantages. And he would point out that it was because he was in a union. He felt that strongly about it. My friends did not. Their families did not. I had a friend whose mother died of a preventable illness, but she had no health insurance. And he pointed out that they were just like me. The difference was through his job, through his union, he had health insurance that family did not. So that has actually illuminated every step of the way that I've taken in my professional life. And I am honored not just to work for the AFL-CIO, I'm honored to work for union people.
Thank you, Charity. Wow. Over the years under Heidi and Ariane, IWPR has done a lot of really great research about the union advantage for women. And I think the combination of that amazing data and stories like Charity's really paints the picture of what it can mean to come together, to organize, to collectively bargain. And here we are, talking about care specifically. So I wondered if you could talk a little bit about what's the relationship between care and the labor movement and labor unions?
Well, at the AFL, we realized that our members are both consumers of care. They have their children in child care. When they need help themselves, there's care available for them most of the time. And as they become older and they're taking care of elderly adults in the family, whether it's their parents or adult children who may have a disability. So they are consumers of care. that's necessary for them to work. It's just like the infrastructure of a highway. Just like you take the highway or the bus to get to work, you also need that care infrastructure to get to work also. We also represent the predominantly women, mostly women of color, over representation of immigrant women who provide that care, and increasingly so. And we know from this warning that the reasons why that work is so devalued, even though it is really the most important work that there is out there, taking care of our loved ones. And so we represent them both, those who consume and those who provide.
Thank you. And I feel like, with all of this union power behind us, we should be winning, right? And there are unfortunately a lot of blocks along the way. And I'm curious if you could talk about what some of those blocks are.
Well, I'll tell you, we are winning. Unions are more popular now than they've ever been. There are all kinds of organizing that's going on out there, but it's really that we're winning and we're organizing against great headwinds. For 40, 50, 60 years, there have been attacks on the laws that protect organizing in the United States. There is a whole industry that has developed that does nothing but tell employers, this is how you prevent your employees from forming a union. Over the past couple of weeks, we've had 2 states that have moved legislation to basically penalize companies in the state who agree to card check. Georgia and Alabama, and card check is recognizing a union because the majority of the workers sign a card saying that they want to be represented by a union. So against those headwinds, we have been able to. But just think about it. If we really had the protections of the National Labor Relations Act, which they're so much stronger under President Biden, they were weakened by a campaign for all these decades. Then under President Trump, there was a conscientious effort to weaken those laws and the regulations and the enforcement of those laws. So we're making a comeback. We know that women have been leading the comeback of union organizing, very young women, women of color in the LGBTQ community. And they have had a rough time in doing so, but they have stood up for their union and for their fellow workers.
Thank you. And last question for you is what's the plan for unblocking progress?
Well, you might have heard your union brother and sisters talk about something called the PRO Act, and that's Protecting the Right to Organize Act. That is extremely important to us because we're trying to undo decades of damage that have been done to union organizing. And basically what that law would do is, this is going to sound like common sense stuff to you, but make it illegal for employers to retaliate against workers who organize unions. Make it illegal for employers to fire people when they're on strike and replace them. Basically, it evens the playing field for workers. There's lots of intimidation. There would no longer would employers be able to have mandatory meetings where they basically put employees into a room and tell them how bad the union is for an hour. Very intimidating. Tactics like when there isn't a union election, putting the mailbox where you put your ballot in right in front of the door that everybody walks in so they know who voted and they can assume how you're voting one way or the other. The PRO Act has passed the House before, and we believe that it is going to become law. The president supports the PRO Act, and I'm going to say it over and over again. If you leave here with one thing, and that is pass the PRO Act, because that's going to help increase union membership.
Thanks, Charity. So we've started with this framework around justice and freedom and economic rights North Star. We've talked about the union advantage for women, the need to pass the PRO Act. We're going to move to Latifa Lyles now. Latifa is Senior Advisor to the Secretary for Women in Construction at the Department of Commerce. And I highly recommend following Latifa's career from the Gender Policy Council, the Women's Bureau at the Department of Labor. Amazing work over the years. And, we at the Century Foundation, where I work, we've written about the links between industrial policy and care policy, how, there's a real connection between the need to have care policy to support that workforce and to make sure there's policies in place where we can diversify the workforce, both because it's the right thing to do, but also because it's the economic thing to do, because there won't be enough people to fill the industrial jobs that have been created out of the legislation that's passed over the last 3 years if we don't diversify those jobs. So you've been doing amazing work on this, and can you talk a little bit about your vision for that work?
Yes, thank you so much. And first, I wanted to just echo my co-panelists. You talked about everyone reaping the benefits of prosperity. And I think that is fundamentally what the government right now is challenged to do with this new set of policies and investments. And there's no guarantee that everybody will be able to reap the benefit of prosperity across the country unless we're very intentional. I just wanted to just at a high level thank everybody here, thank IWPR. In 2 weeks, we will be passing I think it was a year ago, April 18th, the president signed the CARE executive order, which included more than 50 actions at every cabinet level agency, nearly, and essentially did what we could to expand access to affordable, high quality care and provide support for care workers and family caregivers. As well, speaking of the administration doing things people ask us to do or make us do, the president also signed the first ever proclamation designated April as National Care Worker Recognition Month, which is also because of the advocates and the folks on the ground that was signed. Among the actions laid out in the EO included several things. I'm going to focus on the actions that directed agencies to consider applicants for federal job creation or workforce development funds to provide affordable, accessible, safe, reliable childcare and long-term care for workers, as well as supportive services. And we also asked, the EO also asked agencies to consider preferencing applicants that use the funds for this purpose to encourage applicants to use their funds to be as innovative as possible in providing access to childcare and other services. We have an unprecedented level of federal infrastructure investments under this administration, and multiple federal agencies are asking themselves this question: what can we do to make sure that our workforce investments ensure workers have access to supportive services? And also, what can we make sure that those services span both the jobs and the job training programs? As part of the Department of Commerce's workforce development agenda, we've set principles for highly effective workforce investments, including our principles, meaning what we're trying to apply to all our programs, is that they are employer-led, ensure skilled workers are connected to quality job opportunities. This is extremely important, and there has been a lot of efforts to try to improve the workforce development system across the country to have more metrics and more just more systems to connect people to jobs as opposed to just to train people. So this is something that is really, really critical. And basically what we're doing is we're asking the funding recipients to form very, very strong community partnerships, both with labor and educational institutions for that reason. Services I talked about, wraparound services, especially for those in economically disadvantaged communities, increase educational and workplace diversity, equity, and inclusion, including prioritizing earn and learn models like registered apprenticeships, leading to stackable, the programs leading to stackable industry recognized credentials, and measuring and evaluating outcomes as workers get jobs and complete programs. One of the things we're doing specifically at the department under the CHIPS and Science Act, which is a $39 billion program that will provide direct funding, loans, and loan guarantees to support semiconductor manufacturing in the United States. The investment will catalyze long-term economic sustainable growth in this industry and support U.S. economic and national security. Good jobs are at the center of the Chips for America vision for a vibrant and domestic semiconductor industry. It is not what you read in the papers. It is not what is typically covered, where there's a lot of conversation about, this goal the president has. Some of the companies who are looking to build in the United States, there's a lot in that bill, but I think the workforce piece is something we're trying to lift up more and more, because really we have a construction workforce and we have a semiconductor workforce who's going to be operating the facilities. And we really want to try to use intentional strategies for these investments. And essentially, what we were able to do is, in the notice of funding opportunity, we were able to say that for anyone applying for $150 million or more, you are required to provide a child care plan for both facilities workers and construction workers. And applicants under the funding threshold are also strongly encouraged to do so as well. It's really a first of its kind commitment. It also means that there's a lot of ways this can go really well, and there are a lot of things that we can trip over along the way. And so we've really appreciated a lot of the inputs that we've been getting from the community on how to make this work on the ground. We know there's not a one-size-fits-all solution. For one, we expect applicants to devise data-driven solutions responsive to their specific needs of their workforce and geographies. We really want employers to do analysis to understand what their employees need, how many are parents, how many of parents have young kids. We really want to make sure that the community table is set and there's transparency ultimately. So what we're trying to do with these semiconductor companies is make sure that any and all plans and commitments are public, and any of all goal setting and tracking is public as well. There's a lot going on the ground that I think is really, really notable. And I just want to say that coming from the labor department years ago and working on economic security issues, why I'm at Commerce today is because we have a secretary who's extremely excited about the opportunity that she has to rattle the industry to try to get more women in these jobs. And so, the same way we talk about, harassment and educational opportunity, the lack of care infrastructure is really what keeps so many women out of some of these higher paying jobs. And with construction, these are not jobs that require a four-year degree, and they're among the highest paying jobs that don't require a four-year degree. And there's certainly the supply question of knowing that we have lots of jobs that need to be filled. But frankly, we believe that it's also a way that we can potentially shift the paradigm in the industry, which we think if we can do that in construction, maybe we can do it in other industries, since construction is so incredibly difficult nut to crack. These are hundreds of thousands of jobs in the short term. And we know that there are a lot of STEM-related jobs related to the CHIPS and Science Act too, which I'm not going to get into. But ultimately, what we're trying to say is, as we create a new economy in some cities, as we try to create a new industry, new jobs, if we assume everything we already know, we're never going to get there. And so what we're trying to do is to apply more knowledge, and also to try to do things differently. And frankly, there's no guarantee that any of this will work. There's a lot of entrenched industries that, for a whole host of institutional reasons, are not amenable or palatable or sustainable for women, and they could be. And so, talking more to folks that are getting it right, and folks who have sustainable careers where they can support their families, is really what we're trying to lift up. And we're also trying to say, again, the construction companies come to the table, unions come to the table, the CHIPS owners come to the table and figure out publicly how they can make this happen. So there's the other piece of this, which I think we are not talking about as much either, is the fact that We are also trying to make sure that these jobs are good quality jobs. We know that in manufacturing, there's a lot of wide variation between a good quality job and a not so good quality job, women tending to be in the not so good quality jobs. And so in the shops as well as the construction workforce, we are trying to make sure that those job quality standards, I'll call them in this case, are present. And as long as we have the money and as long as we're here, we're going to try to incentivize that money as best we can.
Thank you. Yeah. I feel like you kind of got to, well, first I just want to note how, the theme of occupational segregation, right? That came up a lot. And this is an initiative that really is addressing that head on. Also just want to make the connection, Professor Hamilton was talking about the industrial policy is labor policy. And this may be the first time in administration has ever thought about the people who are part of industrial policy. And so that's a really powerful change. All good. So just curious if you have thoughts on, there are all these researchers and policy experts in the room. How can they help? And I will just put in a plug. We have this beautiful slide at the Century Foundation about the opportunities and risks of the CHIPS and childcare program. And so happy to share that as part of that research. So how can policy experts and researchers in this room help and support this work?
So one thing that is just talking about these new policies and how they're playing out on the ground. One thing that is really a big part of my job is working across federal agencies. So I work very closely with DOT. I work very closely with energy. The vast majority of construction workforce dollars is going through the Department of Transportation. And so, a lot of this policy making is not with the eyes on the ground. And so I think that there's two really important factors about all of these investments. One is that states have wide discretion on how a lot of these funds are going to be spent on the ground, which I cannot overstate. There are some governors and some localities that are taking this opportunity to introduce complementary legislation. They have investments in, New York, Oregon. They have their own CHIPS bills. There are folks that are putting in, apprenticeship requirements. For example, in Illinois, the federal highway dollars that are exclusively spent at the state level through DOT is a really critical, and we've tried very hard through the Department of Transportation to say, you can use this money for workforce, you can use this money for supportive services, you can use this money for childcare. And, that we can only say so much at this level, but it has to be reinforced at the state level. There's a lot of the implementation that is going to happen on the federal, the bipartisan infrastructure law anyway. And so we've tried to do some tables and hubs, and while the administration and the White House has the ability to be a convener, we've tried to go to cities and sort of say we're going to have a hub conversation, which brings in all of the various implementing agencies, but it also brings in labor, it also brings in the state and local government, and it also brings in the development community. In some cases, we know that the state and the public funding projects are doing so much better. There are already requirements that are built into some of these. And so we're trying to make sure that, once the money is out there, there's an accountability measure. And there's lots of ways to do that. There are opportunity committees, there's community benefit plans through the Department of Energy, but there's not one thing. And so what we're trying to do at least is to coalesce around some of these key principles that we all want to do and make sure that the right people are at the table to make sure they happen. And again, there's no guarantee that any of this is going to happen. So that's something that I think I kept up most about. The big gap is, how is this all going to culminate? How are all of our hopes and dreams going to culminate on the ground? Because that's really where the rubber is going to meet the road. Pardon my infrastructure pun.
So good. So good. Thank you. Yes, that makes so much sense. Well, I now want to bring Amy into the conversation. Amy Matsui is the Director of Income Security and Senior Counsel at the National Women's Law Center, where she's doing work with Moms Rising, the National Domestic Workers Alliance, Family Values at Work, Caring Across Generations, and Care Can't Wait on public dollars for public investments in care. And for those who were in the session with John earlier, we talked about revenues and how we can raise revenues to pay for care. And I think the underlying vision around this work is that we could actually have affordable and great childcare, paid leave for all, care for older adults and disabled individuals in homes and communities, a well-paid workforce, a child allowance, if we just used our revenues the way that we know we need to. So can you talk about the work you've been doing and then the new polling and messaging research you've got? I really want to hear more from you. Thanks.
Thank you so much, Julie. And I just want to say it's such an honor to be on this panel. It's such an honor to be here with all of you today. And I really appreciate just kind of the nuance and the thought and the care and just kind of the fact that this is a multidimensional conversation. And so I would like to bring you the dimension of taxes. So today I'm going to use my time on this great panel to talk about raising more public dollars and using those revenues to make public investments in care. The reason we have a tax system is so that we can pool our collective resources and invest in our shared priorities. Unfortunately, over recent decades, the share of taxes that has been paid at the top by the very wealthiest, by big corporations, has declined. And that has really constrained our ability to make the big public investments that women and families and communities have long needed and deserved. So connecting advocacy for a better tax system with advocacy for a better care system is a path forward on both fronts. So connecting fair taxes with better care might sound familiar, and that's because President Biden mentioned it. This was a vision that he raised in his State of the Union this year. And just to kind of bring back those words, what he said was, if the wealthiest and big corporations paid a fairer share of taxes, imagine the world we could create. We could have childcare, we could have paid family and medical leave, we could invest in aging and disability care, and it would make a tangible difference in the lives of women and families around this country. So even though the federal legislative package coming out of the pandemic in the summer of 2021, the Inflation Reduction Act, did not contain care investments, what it did provide was a path forward to make them. It raised taxes on big corporations by implementing a minimum corporate tax, and also by funding the IRS to go after wealthy tax cheats. It recouped kind of tax dollars that are already owed and have not been paid. And it coupled those with investments, public investments in healthcare and in a green economy. So what I want to talk to you about today is kind of what's the next opportunity in front of us to use this template to make progress on care. So we really have a watershed tax debate coming up in 2025. And making the connection between a fairer tax system and the care investments that we need and deserve to make our economy work better, to make the lives of women and families better, is really going to be important as part of that debate. In 2017, the Tax Cuts and Jobs Act was drafted and enacted and passed by a Republican-controlled Congress, and it was signed into law by President Trump. Here's what this law did. So it overwhelmingly benefited the wealthiest and big corporations. The average tax cuts that went to the top 1% of income are obscene when you compare it to what the average tax cut that families in the bottom 60% received. And as we all know, women supporting families on their own, households of color, are underrepresented in those top families and overrepresented in that bottom 60%. So we also know that the benefits of this tax law did not trickle down to workers and to average workers or to families. It did not produce economic growth. Instead, what it did was lose $2 trillion in tax revenue over 10 years. It ballooned the deficit, and it made it even harder to argue for making the big public investments for a sustainable, equitable care economy. So some provisions of the 2017 tax law were permanent, but some of them expire in 2025. So we really are at a fork in the road. We can continue to kind of pursue this failed, demonstrably false strategy of trickle-down economics and tax cuts at the top, or we can make a different decision. We can decide that the wealthiest and big corporations benefit from our economy, they benefit from our labor, we invest in them, It's time for them to pay a fairer share of taxes so the rest of us can also have that fair investment. So I'm going to take us down a little tax policy rabbit hole. Bear with me. There are 4 main goals that we want to accomplish in 2025. So first is to stop the Trump tax cuts that are expiring from being extended. Let them fade off into the sunset. Let them go. Congress should not take action to make them permanent. Second, we need to take this opportunity to enact more policies, in fact, to make the very wealthy and big corporations pay a fairer share of taxes. And there are many options to do this. There are at least half a dozen that are in President Biden's budget proposals alone. Third, we need to continue to fully fund the IRS to fairly administer these policies and to continue to support the tax credits that Professor Hamilton mentioned that help women and families with low and moderate incomes. And in fact, 2025 also offers us that opportunity to kind of make these permanent improvements to the child tax credit and potentially other refundable tax credits that benefit low and moderate income families, boost their economic security, help improve the well-being of children, health, their economics, their employment outcomes. I could go on and on. But in fact, because we know that women and households of color are overrepresented in the families that benefit from them, it also boosts racial and gender equity. So the other thing that I want to just kind of point out about 2025, now that we have gone down this little side road of the track of tax policy, is to point out that if we do this, if we're successful in making these arguments in 2025, we will raise billions of dollars in new tax revenue that can be invested in the supports that and the infrastructure and the economy that all of us need and deserve, like care. So Vicki and others have mentioned the polling today. We heard about polling, and I wanted to share with you a little bit of a preview. This is the first time I've talked about this polling, so bear with me if it's a little rough. But I wanted to share some top lines from recent polling that make a connection between taxes and care. Okay, so I'll start by just kind of the little bit of information about the survey. So as you saw, this was a survey that Moms Rising and National Women's Law Center worked on with Lake Research Associates. It's an online dial survey, and it looked at it oversampled women of color, Gen Z women, and parents of children under age 12. So, and I'm sorry, the print is really small. So I will start by some things that you all know. So first, the care agenda is tremendously well supported by the public. There is strong support across demographics, including race, gender, age, parental status, political affiliation, to support care policies. They also note that they believe that care investments will positively impact the ability of families to thrive and also boost the economy and jobs. The other thing that we know very well is that there's very strong public support, again, across a lot of different factors for increasing taxes on the wealthy and big corporations. So what we wanted to find out with this poll is what happens if you put the peanut butter together with the chocolate and you combine care and taxes. Here's what we found out. So after hearing that if we let the 2017 tax cuts at the top expire, we would have more to invest in things like care, 2/3 of the respondents agreed that we should let the Trump tax cuts, shorthand, for the wealthiest expire. So we kind of put this question to them, and this was their answer. We also found that after we talked to the respondents about care policies and tax policies, we actually increased support for increasing investments in care by raising taxes on the wealthy and big corporations. We got 77% of respondents saying that this was something that they favored, and it includes a strong majority of independent voters, 80% of them, and 59% of Republican voters. And the other thing I'll note is that after hearing these messages, intense opposition to extending the Trump tax cuts at the top increased. In particular, opposition from Latinas, caregivers, Gen Z women, voters ages 50 to 64, AAPI women, and parents of kids under age 12, their opposition increased. So I know I'm running a little bit short on time, but I want to also just note that we tested some messages that connected care and taxes as part of this polling. And these were two, because the print is so small, I'm going to read them out, that got very strong support. So the first is, we should not give huge tax breaks to wealthy corporations that exploit loopholes and avoid taxes by stashing profits offshore, while working families are forced to solve the care crisis on their own. The second message that we tested that got very strong support was that it's wrong to ask families caring for loved ones and struggling to meet caregiving needs to pay for tax breaks for wealthy corporations and the wealthiest 1%. So broadly, what we found when we tested a number of narratives was a couple of themes that I just want to leave you all with. And that is, if we raise unifying themes, if we talk about things that benefit all of our families and the fact that we can band together and make policy changes, we can be those social movements. These are strongly supportive narratives that help get us where we are. We think that these results underscore the power of combining good taxes with good care policies. And we're looking forward to sharing these messages with both care advocates and tax advocates and using them to win tax fights in 2025.
Thank you so much, Amy. There's so much rich content here. I want to open it up for audience questions now, but also as panelists respond, if there was something you wanted to say in response to someone else, take panelist privilege, start with that, and then go ahead and answer the question. So do we have questions? Okay, Mia.
Hey there. Yeah. So, hi, Latifah. It's great to see you. Mia Dell, AFL-CIO. I work with Charity Wilson. We are so excited about the childcare elements of CHIPS. I mean, CHIPS in general, but the childcare elements. I'm wondering if anything is being baked into this so that surely some of this will come to be. Are you capturing the data so we can have proof of concept and rebuild it again later?
Yes. Two answers to that. One is that where possible, we're also trying to leverage and benefit the care ecosystem where these facilities are going to be built. So part of what we're hoping is that we not only, I mean, obviously construction is short term, but what we're trying to do is to pair this and encourage sort of more local measures of care and care supply and care needs that's more geographic as opposed to just related to the company. And so that is something that's going to take a lot of work, obviously, but we're really trying to make the right people at the table so that, we have more data that will help the broader state policy ecosystem as opposed to just here we want people to obviously track what's happening within their company, but we think we have a unique opportunity to actually apply this to more, measures that are at a municipal level.
Hi, I'm Robert Blecker from I'm a professor of economics here at AU. First of all, a shout out to Derek. I loved your line. The economy is a choice variable. I wrote that down. I'm going to remember that. I'll attribute you, of course. And
that's all we want is academic attribution.
to Charity, I would say my grandfather was also a union founder, so we got something in common there. I appreciate that. But my question is mostly for the last two speakers, but could be for everybody. It seems to me that the Biden administration in the economic space has done something that is both remarkable and also risky. The kind of policies you're talking about, while they have some short-term impact, they're mostly long-term. They're spread out over many years. A lot of the benefits could take years or decades even to be felt. So we're not seeing it in the polling, and it's risky because both our news media have an incredibly short attention span, and the political system in the election system is very short run focused, and we hear so much talk about the price of bananas, and we're not hearing enough about this. And that kind of relates to what Amy was saying. If you could put together a coherent package for people, they say, oh, wow, I support that. And yet you look at the polling that, where you don't give those choices to people, it's just sort of the raw polling. There's a disconnect between where you can move people by explaining those connections to them and where they are in terms of who they might vote for in November. And so how do we bridge those gaps politically? How do we get the long-term view, which I think it's right to take, into the political discourse, and how do we get that message out about linking issues? And I think it was actually Derek who talked about the North Star. Keep the North Star in charge of the political dialogue instead of the latest number of the CPI or whatever it is. Thank you.
I 100% agree, and I was just, not being like a political communications professional. I will say that you're 100% right in that the vast majority of these investments are not going to bear fruit until well past this administration, in terms of job creation, in terms of local economic stimulation. So that is absolutely true. I do think that, from what we've seen is where there are very, very strong connections to communities. So those are like, we have mayors and governors and others who are, really, there's, state infrastructure, there are offices that are being created right now throughout various governor's offices. There needs to be a local story that I don't think has necessarily been told or even developed yet. And there's some promise there, but it is indeed a big challenge that we have.
So I'll kind of start with there are a couple of different things that I'll say in response to that. And I think that we're, as Latifah was saying, like we're really ill positioning ourselves if we're telling people, just hang on, like ignore the reality of your life and that you're struggling from paycheck to paycheck and that you're working an extra job to pay for childcare. We have to kind of acknowledge what people are experiencing. So I would just say two things. So one is that the tax system actually gave a proof point of government that works during the pandemic. So both because we were able to see the child tax credits get delivered to, over 90% of families who were eligible. And we heard from families in real time that when they got those extra dollars in their bank accounts, they used them to pay the bills, they used them to put food on the table, they used them to give their kids a little something or buy new shoes. They were using them for the things that their families needed, and it gave them that autonomy of choice to make the decisions that worked best for their family. And that's that's kind of as Derek was saying, like putting the money in the hands of families who need it and use it is part of a bigger economic story. It pumps money back into the economy, but it also gives people the dignity of choice and being able to make those decisions for their families. And honestly, like another proof point that we saw is from the Inflation Reduction Act funding that went to the IRS, when we saw that they're able to collect kind of, taxes that weren't paid by very wealthy people who didn't even file a tax return for many years, so that we can kind of see through the tax system that this is something that government can do, they can do it and it works. And the other thing I'll just say is that, again, I think that the proposals that are on the table, be it for childcare, paid family and medical leave, or for home and community-based services, again, there's a ramp-up time, there's investment, but it's addressing an acute need that families feel every day when they are worried about, calling to make sure that their parent's caregiver got to the house and correctly administered medicine and got the food there. And they're picking their kid up at 5 because at 5:01 they start getting charged $10 a minute. It's addressing their needs, and it's answering something that, women loud and clear said was front and center in their lives during the pandemic and every minute since.
I'll jump in again real quick and just double down on your point and say, with the child tax credit that reduced poverty and did a lot of great, but why didn't we just say that every tax policy that's a credit should be fully refundable? That why don't we stake out some claims and have some larger vision that will even help the next time the child tax credit is controversial because it it has a refundability, even with care, right? So a lot of good with the CHIPS Act to promote care, but the North Star is if we have guaranteed care for everyone. Why don't we stake out the North Star claim and then have the issues? Now, clearly, if we have the North Star claim without the issues, we'll be limited, but they both are self-reinforcing and necessary, and part of the reason why the progressive movement is limited and doesn't have sustainability.
Thanks. Other questions? And while we're getting to it, I'm just going to shout out that Kate Bond had a great article that was very much about what Amy just pointed out about the disconnect between the economics and the lack of a care infrastructure. So highly recommend that piece. Any other questions? Well, then I'm going to give everyone a chance to have one final thought. You can either give one that you were inspired from listening to everyone or answer a question around what is giving you the most hope right now. And we'll start with you. Yeah.
You know, the last 50 years that some people label as a neoliberal economy has been one where we have a rhetoric of free markets for everyone except poor people. We discipline them, and I'm not the first to say this. There's a great book by Sauce, Sanford, and Schramm, and I'm forgetting the authors' names. Why don't we flip that equation? Why doesn't the federal government engage in such a way that if you're going to have a private sector, there's a counterbalance. There's a counterbalance to that power. So there is a baseline that if on goods that are essential, without which we're vulnerable, like healthcare, right? Right now, the mechanism to determine who has access, quality, and quantity of healthcare is a price rationing mechanism. That's immoral. Why don't we have a situation, whether it's banking, whether it's medical care, essential goods that provides a baseline level that people are going to have adequate quantity, access, and quality, and after which, if you want to have a private market, have at it. But at the very least, if you're going to engage with the American people or any people, these are the terms by which you have to engage. And then really quick, taxes are critical. Of all this, if we're talking about care economy, industrial policy, the biggest fiscal tool we have is tax policy. A tax cut is activist government. It's the strategic direction of resources for industrial purposes to a certain entity or class. So we should not abandon tax policy. We should be keenly focused on it. And we should think about tax policy not just as revenue collection, but the ways in which we can strategically direct resources. We have refundable tax credits, for example. But I will have one slight counter to Amy. I don't think we need taxes to pay for things. We don't need to be constrained and to pay for with taxes. We need taxes to rein in plutocracy. There's too much power in certain domains where they can spill over into our political process and restrict us from doing things for our common good. But we've seen time in and time out that the U.S. as a sovereign monetary entity has the capabilities to fund and pay for things that lead to and enhance our productivity.
Thanks. We'll go to Amy next.
So I agree. I would be foolish to disagree, but I agree with everything that Derek just said. And I will say that the thing that's giving me hope is, I think that people deserve a lot in their lives. In order to live with dignity, we can't say there's a single silver bullet that makes people's lives sustainable and rich and rewarding and dignified, where they feel that dignity, that they're building towards the future, but they're having a good quality life now, and that they're able to savor the work that they do and also the relationships with their families. And so I think the one thing I want to say about kind of this vision of taxes is that I agree we don't need to pay for every single investment, because all of these investments are intended to make people's lives stronger and more resilient and be able to enable them to contribute, but also not kind of premise their value entirely on what they're contributing to the economy. But if we are disciplined and strategic and thoughtful and recognize kind of all of the things that all people need, I think that we can work together to raise the revenues to support, but not entirely pay for all of those investments.
Thanks, Amy. Latifa and then Charity.
Sure. It's hard. Hope. So the first thing I thought of was like a challenge. What I'm hopeful for is that we are able to start having a conversation about the lack of care impeding people's ability to work and employers' ability to get their jobs done, and not in a theoretical way. So, it's sure there'll be lots of people and women who benefit, but in the infrastructure space, what we're able potentially to say is that you started off by saying we have all of these jobs that need to be filled, but there has to be job quality first and foremost, and without it, we're not going to build a bridge. We're not going to get the road back. And I think that's a slightly different way that we have been thinking about this, in a sense that we are faced with a dearth of workers who can fill a lot of the jobs that we've been talking about. And so, on the flip side, we have this opportunity could sort of, demonstrate just how entrenched these old systems and structures are, which hopefully that doesn't happen. We don't want to be 10 years from now and only white men have, gotten the million jobs we created. So I'm hopeful that, this provides an opportunity for us to try to move the narrative that can also have policy ramifications ultimately.
I guess I'm closing us out. When workers organize, workers have the power. The biggest backers of unions are Black women. And that's because Black women know that when they're in a union, their pay is going to go up. They're going to make more than their non-union sisters. They're going to make about 13% more. For Hispanic women, it's 20%. For women overall, it's 5.8%. They know that they're going to have benefits such as health care, a pension, paid time off. Union contracts, over 90% of workers have access to those. It's between 65 and 70 for non-union. These are the things that make your life livable. This is what gets you up in the morning and keeps you happy and keeps you going every single day. So although it sounds odd to basically lobby for a bill, which I did while I was speaking, it was because it's absolutely necessary. It is economic infrastructure for workers to be able to organize a union. And I'll say that I met my sister from SEIU 1199 earlier today, whose name is Faith. I'm Charity. There she is, there she is. And we both agreed, we have the hope.
Thank you so much to our brilliant panelists. One more applause. Thank you to American University and to the Institute for Women's Policy Research. And I'll turn it over to Robin to close us out.
Say it for the last time. Is this on? Yes. Like Julie mentioned, this has been a rich conference with a lot of information, and I have been crazily taking notes trying to capture it, so I'm definitely not going to do it service, but I wanted to, again, say thank you to Julie, to Derek, to Charity, to Latifa, to Amy for an amazing panel. And I would be remiss, I've been up here, I've been emceeing. I just play an MC on TV. I am a researcher, I promise you. And so I feel that I'd be remiss if I didn't mention that being a health services researcher and one who focuses on health disparities, that I appreciate that Charity and Krishana Lloyd brought into it their lived experience. I think what is important if you're trying to change policy and influence it, that we can give a lot of data and evidence-based research, and that's what we do. But if you do not bring in the lived experience and make it relevant and relatable, it makes it hard to change the narrative, makes it hard to make a difference. So I appreciate that, and I thank you for doing that. Okay. So I hope you enjoyed this conference. If you did, please give it another, hand of applause for just all of the speakers. I think, this has been a full day with a wealth of information. I think we have an increased awareness of the complex issues surrounding care, a clear understanding that care is undervalued and underfunded in the U.S. economy, the impact that this has on caregivers and those in need. We know that impact is worse depending on your race and ethnicity and other different intersectionalities like, gender identity, class, ability. And now with this panel, we've heard about some actionable strategies to advance equity within care. And I think, I started this session off and I talked about that everyone will receive care in their lifetime and that everyone will probably, I'm not going to say probably, will give care to someone else in their lifetime, whether it's just because you love them or it's part of your job. And I wanted to point out that Mia Ives Ruble said earlier that everyone is worthy of care. And all of us wouldn't be in here doing the work or at this conference and I appreciate that Julie ended it, if we didn't have hope that there will be change in the care environment. So that being said, I want to close it out by, again, thanking all the speakers. I want to thank all of our funders who support IWPR's work. Without them, there would be no conference. there would be, no work. I want to, again, I know Julie said it, I want to thank American University for hosting this event and the continued partnership. I want to thank Heidi Hartman, who's the founder of IWPR. She spearheaded this collaboration with AU, and so that beyond founding the organization, but also this relationship. And as you guys know, it takes a village to put together a conference. I like to say that if you've done a meeting, it's like a duck. They're really smooth on the water and then their feet are going crazy. So we have a lot of people that were behind the scenes being the feet of the duck, and I want to lift them up. I want to lift up our conference committee, and that is Mika Mirrors. Was she still in here? There she is back there. Assistant Professor Maria Cablo Sanchez, is she in here? Oh, she might. Oh, are you back there? Okay. Also, there's Sue Bach, Assistant Professor Sue Bach, is she here? Okay. And then Megan Dugan, she was the events manager of Constitution Hall. I don't know if she's here, but she might be outside, so I want to give her some credit. And then we had a number of AU students who volunteered and so forth. And then lastly, I've asked all the IWPR staff to come in. And so if you are here, I know there's some along the walls, I would ask you guys to stand up. So yes, I want to thank you guys for giving of your time and talent and to make this a success. And I know oftentimes we, particularly in leadership and those of us who do the research and sit on panels, we get our names said. So I'm going to say each of your names. I'm going to thank you. Amber, Ariane, Martinique, Emmy, Nora, Victoria, Fiona, Beth, Shannon, Ksenia, Tessa, Ben, Will, Nina, Susan, Hannah, Christy, Martha, Yasser, and Jennifer. Thank you. And I want to thank all of you guys for being here. I'm going to close it out by reminding you that we will be hosting a reception with small bites and refreshments from 5 to 7. I have been instructed to be really clear that it is a hard stop at 7 because they're going to be setting up for another event here in the morning. And then lastly, I want to invite the guests, if you like this conference, we do good conferences. So we have another conference. We have our IWPR's Power Summit It is called From Research to Revolutions, Women's Voices in Policy. This, if you've gotten the save the date has changed. This event has a new date. It's in September 23rd and 24th in the Windy City. So we will be in Chicago. Yes, I like that. That's my city. I appreciate that. So we hope to see you there, and thank you, and have a good night and enjoy our refreshments.
you.